Okay, great. Good evening, everyone, as we join together in another regular session of the West Ada School Board. As is our custom, if you'd please stand for the Pledge of Allegiance. Thank you. Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
That brings us into session, and beginning tonight, we are very privileged to have two special speakers for our spotlight. To begin, Ms. Gina Pinnell, who is with Central District Health, and she will be discussing some of the initiatives they're taking and be open for questions. Mr. Pinnell, you have the floor.
Good evening, everyone. Thank you for the opportunity and the invitation. So I'm here today to talk a little bit about what we're seeing in the community. We make a recommendation every Monday on what category we're seeing for level of community transmission. And this Monday, we did give a Category 3 recommendation. We are just, at the point in time we made the assessment, we're looking at the weeks prior, and we still have a number of cases that we definitely have an improvement on, but it wasn't to the level where we felt we could meet those Category 2 metrics. So that is an indication I know that you look towards every Monday for assessment on how you make decisions and how you operate. There's a couple more Mondays before the Labor Day, and I can share that we are seeing a decline, and we're very hopeful. I know hopeful is not necessarily a strategy, but with our social gathering reduction and some of the other mask mandates that are in place, we are seeing what we would like to see on our end to be able to bring those case rates down. So I asked my team before coming here, if you were standing in front of a school board meeting, getting pointed out for questions, what feedback would you get for the probability of us actually being able to move into a Category 2? And their answer was, if we continue to see the declines that we have been seeing, then the answer would be yes, there is a chance. It is possible that on Monday or September 8th, we would get that Category 2 determination, which would inform your plans. One of the things that we did discuss in looking at your plans and how you want to reopen is, this is definitely not a sprint. And if you've been sprinting, you're very tired, but it's a marathon. And so slow and steady is really our recommendation when we're looking to schools of how they want to operate. And the reason we say that is because schools and children have not been in session. You've had programmings and you've done well with your athletics, and you have had programs in place, and we've been partnering with you along the entire way. So I want to make sure your school community knows that, and the board members know that. We've been working side by side since March. It feels like a lot longer, but since March. And we've seen success, and there's definitely room for improvement on everybody's ends, from how we respond to the way that things are set up in the community, and your school community. We look towards those case rates as an indicator of what we're seeing overall. And the reason that it's a concern for the school when rates remain high is because essentially you will be functioning as like a fishing net, catching these cases that already exist in the community as they come into the school setting. And that's okay. Businesses are functioning in that role, hospitals, workplaces, various entities are doing that. And schools are going to be the new addition to that ability to catch and contain and isolate and make sure that these individuals aren't continuing the spread. And the question I think that should be considered is, how many of those fish do you want to catch? And when the spread is high, like it is now, it will be a lot of work to respond and catch those individuals to make sure that they're safe and their teachers are safe. And so bringing those case rates down and making sure transmission in the community is at a lower level will allow you to do that in a way that is intentional and staggered, and your plans are intentional. I don't want to mislead anyone. They were very thoughtful, but we look at how schools can reopen in a way that allows students to adjust to a classroom that they've never been in before, teachers to adjust to teaching in ways that many have not done before, and how can we do that successfully. And there's a lot of pressure on you. I feel that, and I feel that in our role too, to do it successfully and do it safely. And there's success stories in other countries that they have done it safely by social distancing, by masking, by cohorting, by reducing class sizes. And there's countries and states in our own United States that have not done it well, and immediately after opening their doors had to quarantine. Georgia comes to mind, over 800 students the first week. So making sure that you feel comfortable with that level of community transmission, that people in the building, students and faculty and teachers understand that the expectations are different, is really key. The other thing that I want to talk about briefly is, I know if you've ever looked at our metrics for the categories and how people move into different categories, you're probably as confused as I am. They're really difficult and challenging to understand, and really our epidemiology team is the one who gives those indicators to myself to be able to share to the community, and it's challenging when you can't interpret that. And so I want to share that we are working on trying to simplify those, so schools have a better understanding, parents have a better understanding of what level we're in when we're moving in the wrong direction, not just a Monday report that comes out on our website, but how can we inform the community, teachers, staff, faculty, districts, parents, students, about what to expect. So when you see those case numbers potentially start to rise, which there is some expectation cases will happen in the school, that you're prepared to switch that plan potentially to a category 3 when we move to a category 2, because I want to get there as well. And so those are forthcoming. We've been working diligently, our whole team, on trying to make that happen, and no metric is perfect. Even if we use the case rates, the average case rates, there's variables in there that that will account for an increase in those case rates. And how do you level the ability to understand the risk to the community based on those cases? And as an example, if there's mass asymptomatic testing because there's an outbreak in a power plant, that's going to raise our cases over the period of a time. And does that mean that our community is any less safe? We don't know. Technically, we're all interconnected, so if those individuals live and work in our community, then we can't necessarily just remove them from that total case number. So I share that because I know metrics have been a hot topic, in the sense that they're really complicated, and it's one of those indicators that we want to be able to share with you that is simplified, so that you can help make those decisions prior to having conversations with the health department, knowing that that will continue over the course of time. So those are the things I wanted to mention, and I'm happy to take questions.
Well, thank you very much. I really appreciate you coming tonight as well. I know it's a very busy night for you. I did have one question before I open it up to trustees, and I was curious, you're talking about reporting. Do you think it would be better for a school board if we were able to get reporting on what kind of metrics or what kind of infections and cases are in West Ada from CDH, and is that even possible?
It might be possible. I don't want to make that commitment because I'm not sure. I know that it could be possible. One of the factors, because it's community transmission, is we don't always know the source of spread. So making the assumption that the spread came from the school is not necessarily a good one, right? When students come into the school setting. Once school is in session, what we will be looking for when a positive case comes into, shows up or is at class and exposes others, is what were the additional exposures as a result of that positive student or teacher. Those are going to be important, because honestly, they'll tell you whether your mitigation measures are working or not. So I would say tracking those, we can possibly work with you from our team to help you track that, but I think if you have a centralized way that you're tracking those internally, you'll be able to identify who is additionally becoming positive as a result of exposure at the school setting, because I think that's what you're asking, is how do you assess the exposure risk within the school and the outcomes of that infectious person to other people.
Excellent. Thank you very much. Trustees, do you have any questions for Ms. Pinnell? Trustee
Mr.
Smiley?
Chairman.
Trustee Smiley, please.
Thank you, Mr. Chairman and Gina. I really appreciate all the work that you have done. One thing that weighs heavily on me, and this is something I have been reading your releases, I have been reading the daily updates from the Statesman and the Press Tribune, and one thing that I really struggle with is we get raw numbers, and then every once in a while we say, well, these people were in their 80s, these people were in their 70s, these people were, and they sometimes, but that information is often lacking. And as schools, we do have older and retired people that are aides, bus drivers, so forth. but it is really hard to get a feel of the actual community spread in the community versus people that are in an assisted living facility or that are in some other thing that perhaps already have compromising health conditions. And that is, it's basically guessing. Is there any way that we can get more clarity on those numbers of who exactly is testing positive, how many people have been hospitalized and so forth, and could we get a better feel of that? And I know that's asking a lot, but that's information that would really be helpful.
Yeah, I understand your question and your concern. I think you can parse through the data dashboard that we have, as well as the Division of Idaho Department of Health and Welfare, and you can find some of those answers. And when I brought this question to the team, because schools have asked this pretty much for the last 3 months, is what you do see in the community because of the way the virus works is that the question comes, why do we have to consider long-term care because they're not in a school setting, right? And do they impact school transmission is a question I get often. And we don't know that answer because we don't know whose parents work in a long-term care center or an assisted living center who are eventually exposed or as exposed as a result of the practices that are or not in place or the level of transmission in that individual system. And whether that's the same question comes about IDOC, the Department of Corrections. Do we need to count those cases in our community spread? How do they impact our community? And when you start digging into that, those people, some have work release, some people remain at home, and have monitors. And so how do those look? And once we start making exceptions, then the list gets more and more people ask for those exceptions. But what I think you're asking, is there a better way to show potential school impact, kind of what Ed was mentioning, the impact of transmission and the impact of infections in a school setting, maybe for the younger population and the teacher population, and can we slice and dice that a little differently? And I can bring that back to our team as an ask and see what they can do about that. I know why it's important to you, and when I continue to bring that, the question that comes back to me or the response that comes back to me is the level of community transmission remains high, and if this was a boarding school and West Ada had boarding schools all around, it might be different and the staff resided here, but that's just not what we're seeing. And we even have people using transportation to come here from from Canning County, which is also high, in fact higher than Ada at this point. And so how do you account for those, and how do you account for that where you have students maybe transitioning into this county as well to attend school? So I will bring that back as an ask and see if there's something else, an additional and more refined, that we can provide for you and for school districts across the counties.
Yeah, Mr. Chairman, if I can follow up, thank you for that
Sure.
answer, but this is something that you can just imagine what our email boxes look like.
Probably like mine.
So we're on the same team there.
Yeah.
And I have heard this repeatedly from staff members and grandparents that are raising kids and so forth. I've heard the same question over and over again, and I frankly don't have a good answer for them. And that's one thing I could really use some help on.
Okay.
Thank you. Any other trustees? Trustee Newhoff?
Thank you, Mr. Chairman and Ms. Pennell. I have a couple of questions that are related to the timing of reporting and how that affects our decision making. The first gets back to the state guidelines that give rise to the colors or categories. And I mean, you talked a lot about case numbers, but that's not really in the guidelines, as I understand it. It's the nature of transmission. And one of the things I noticed in both the yellow and the red guidelines is that there are 6-week lags built into those. Certain types of transmission events that have to be at least 6 weeks in the past. Can you give us some sense of where we're at in the red with respect to the last time CDH saw that type of transmission event?
Sure. So Unfortunately, the Back to School Framework was a partnership with a bunch of people, and I was one of a number of people on that Governor's Reopening Committee, which all were educators except for me, the lone public health person. And so when we actually saw that 6-week closure, that was a new thing that we had never seen before until that became public. So I think that was looking at when transmission becomes high and substantial, it's not going to be just a couple weeks. And as we've seen in Ada County, cases continue to rise. We have a mask mandate in place, we have social gatherings in place, and it has taken since mid-July or early July for us to start to see the numbers. So I think that I'm making an inference here, what they were thinking about. When we look at the Category 3 metrics, I don't have them in front of me, but it's looking at clusters of cases that become indistinct. It's looking at how this is impacting our hospital setting, and not just the hospital, but the number of COVID admissions. Are they looking at crisis standards of care? You know, some of their things internally that they're managing to look at impact, and then just levels of community spread, and are we seeing it in multiple community settings? And even as of last week, which we used to make the assessment for Monday, it's in daycares, it's in long-term care centers, we talked about that, it's in other bigger communal settings, and so those are the indicators that we look for, and not the timeline that's looked at in the Back to School Framework. When I mention case rates, that is something that the health department is working on making a modification for, because we understand our current metrics are really challenging. And it's kind of information that we have, and you can look at total numbers and look at the media, but there's not a really transparent way for other people to understand kind of the further reasoning as to why we're in level 3, which is probably why you're asking the question. And so the case rates is something we've just started examining starting last Friday and this last few days to make it easier for people to interpret the current level of transmission based on the numbers. And there is no magic metric. I wish there was a simple one, and I think every country and every state would use it if we had one. What also comes into play is, there's a lot of reliance on those positive tests. And for a while there, it was really challenging to get a test unless you had symptoms, even if you were a close contact. So it's not that in of itself is not a perfect way to know the true level of transmission. We just know it's here, we know it exists, and all of the standard measures that we've worked with schools to implement, the social distancing, the masking, the sanitization, and the hand washing, those are the things that are going to prevent it from maybe coming into the school, or if it does come into the school, then to stop it from spreading from student to teacher or teacher to student, and infecting the classroom.
Okay, and kind of following up on that, one of the struggles I'm sure that has you guys pulling your hair out is the lag in getting test results, which sometimes is 24 hours, sometimes is 3 weeks plus. And what's the sort of level of exposure right now in the testing environment in terms of, say, there's something you don't catch because it's coming back, and the symptomatic testing, my understanding is that that's what's lagging the most in the data set. It's not the asymptomatic screenings at IDOC or at St. Luke's, for instance. It's the high probability results. So, we move into yellow, how much risk, in terms of how operationally CDH is sort of gaming this? I understand that you guys are spending a lot of time trying to, run the marathon here. But, the thing that scares you is that there's some slug of positives that are coming in that you didn't know about, and you go down into yellow and like, boom, and one of the things we have to concern ourselves with is, as much as we want to be in school, the yo-yo back and forth is probably not a healthy consideration either, so.
Yes, and yes, we do share the same concern. And right now, because there is a decline, the testing results are being turned around much quicker than they were 24 to 48 hours. So people are able to quarantine, and more succinct instruction is being given from the healthcare provider. So there's a lot of assumption of, I need to wait for the health department to call and tell me what to do. But if you're waiting a test result, then you should be quarantining. So that's becoming a little more common knowledge, and healthcare providers are providing that guidance. And they probably were before, but maybe more consistently across the board. We also share in the concern that a large bulk of testing is going to come in that we are not aware of. We have a lot of connections in the community, and if there is a lag, and for example, there was with one of our hospital systems, they called us and said, hey, we changed labs, and you can expect to see a certain number of cases that have not processed yet. So those are things that a simple metric like average case rate per week, that we can use that as a general community indicator for when to move, but we are going to have situational awareness based on the relationships and the information that we have that just the general public isn't going to have. So even though those case rates will be public and are being discussed, it's still going to be weekly calls with your health services team and your assistant superintendent, and I have those every Monday and Friday, and we are talking, I feel like every day sometimes, to try to get a gauge on when that happens. One of the things that we're considering is when I said, yes, it is possible that we could get to a Category 2 by Monday or by next Monday on Labor Day, is do we want to wait until it's a little better than just crossing over that little finish line right there, because that doesn't leave a lot of cushion for exposure. But if you bring those case rates down below that, and you see transmission getting better than it is now, and you just have a little more flexibility onto what you can see in the community, as far as being able to not have to flip-flop back and forth between 2 and 3, because I am a parent in Boise School District. I don't want to do that. I know no parent wants to do that. No teacher wants to do that, to have to go to in-person learning and then virtual learning back and forth. And so what are those indicators, and what are those conversations we need to be having to try to get as much information to schools as possible for them to make the best decision they can at the time that they need to make it?
Thank you very much. Trustee Johnson.
Thank you, Mr. Chairman. I have kind of a different question, and it's around mitigation, because clearly we've had a number of cases happen now, and I know, we've had daycare facilities and other facilities that operate like a school. So I want to know what you've seen as far as, have the mitigation protocols that you've asked to be put in place been containing the outbreaks in those facilities? What have you been seeing kind of across?
The answer lies in the consistency of those mitigation strategies and being able to hold those mitigation strategies for a school day or the week of school. So when entities are able to practice those standard across the board consistently, we see less transmission and less infection. When exceptions are made, when guards get pulled down because things are being, things are okay, we haven't had a case in a week or so, or whatever that might be, that's when we see cases rise. And so the consistency of that and the ease of being able to implement those is also a factor. So when you have, and I'm hypothetically speaking here, but when you have a daycare that has more children than it should have to account for social distancing, and in those younger groups, I don't want to fool you that, small children are staying 6 feet away. They're cohorting, or they're like looking at groups of 10 and not letting those groups of 10 intermingle, which is some suggestions we gave for younger students in the public sector for elementary. When they're able to maintain those and they have the staffing level to do it, then they can. But if they have 2 groups of 10 and one staff is out sick, then all of a sudden you have a group of 20 kids together, and that mitigation is inconsistent. And those are when we see the cases, the infections and the exposures happen.
Follow up, Mr. Chairman.
Please.
So can I follow up on that a little bit? I guess what I'm trying to understand, so I've got some community information around the different daycare, and I'm equating them school age as well, right? Are we seeing that when the safety protocols and the mitigation strategies are put in place, that we actually can contain, so if there is a positive case in there, we contain the spread entirely, or are you still seeing spread?
The answer is both. So if the instruction from the health department will be for a family, if a child is positive, to go home and isolate or quarantine. The expectation for those siblings then is to not be around that other's brother or sister. That's kind of impossible for a lot of our families who don't have housing or the resources to be able to do that. So then we automatically see exposure as a result of that. Does that mean it's a fault of the entity? No, not necessarily. So what we have seen with sports, for example, is that you can contain it. You can have the positive case and the mitigations were in place that stopped the spread from there because everything was in place as the way it should be. But it's when we get into the home setting or maybe the community setting outside of that entity where you don't have those controls and where their resources vary is where you see those cases and exposures happen as a result of the case in the entity, like the daycare, for example, or the school.
Okay, thank you. And then last follow-up, Mr. Chairman. I know we talked about the data not being really understandable or clear to the rest of us right now, but I'd like to get some clarity around maybe the data isn't clear, but what are you really assessing? Are you assessing how, what the hospital system capacity is? What I'm trying to get clarity on, and it's really hard for lots of us to understand, is in those conversations with those epidemiologists and you, and the decision-making, which is frankly right now not very public, is what discussions are you having? How are you making that decision? Because that's the hardest part to understand right now. I know the data may be complicated, but really, how are you making that decision? What are they basing it on, I guess?
Sure. So I will default back to the Division of Public Health, the metrics that they gave, which was based on the back to school framework. And they have, for category 3, they have 3 factors. One of them is when clusters become indistinct. And from our perspective, what that means is that we can't contact trace and we can't investigate and we can't stop it. The way that a virus is stopped is by identifying the person who's infected, quarantining them, contacting the people who they were close contacts with because they had an exposure, and quarantining them as well. When we can't do that because the spread becomes too indistinct and we don't know, or people don't return our phone calls, or there's a lag time in testing and a test result is basically useless because it's already been 10 days, those are the things that we see as the number one indicator, which we were seeing in our community. It is getting better. We're still seeing some of it. The second indicator is the healthcare impact. So I understand the concern of just not protecting the hospitals, and I share that concern. But what we see is they need to also be able to account for time-sensitive surgeries so that if you or I get in a car accident, they have room for me. Because if they don't, then I die as a result of COVID, or someone else dies because the hospital can't account for a bed to treat me because they're focused on only COVID patients and their exposure is so high, and then they have staff out and just their capacity is decreased. So that's a consideration that we're looking at, is what is the total impact for them for COVID admissions and their ICU beds and the resources. And I didn't get the chance to watch the governor's press release earlier this week, or maybe it was last week, on the level of PPE that hospitals have, but recently it was like 10 days. That is not very many days. If there was a mass exposure, to be able to care for individuals and have the healthcare staff remain safe. And then the third factor is the community, in the multiple community settings being impacted. So seeing cases in daycares, churches, summer camps, youth sports, I mean, you name it, we're seeing it. And those are the 3 things that we look at as far as internal metrics that share based on the number of cases we're seeing, based on the close contact investigations that we're doing from our epidemiology team, based on hospital data. And St. Luke's and St. Al's just recently published their dashboard to look at positivity rates and COVID admissions on a rolling 14-day period. And that's really helpful for the public to see, is what is that complete impact for the hospitals, because we do need them to help care for those time-sensitive care needs and emergency needs outside of COVID.
Thank you. Trustee Ozuna, did you have any questions?
I do. The advantage of going last is most of my questions were asked. I'm curious, have you guys had any conversations about continuing the mask mandate into the yellow category?
So we have some community metrics for our public health order that we look at, and it's number of cases per day that we're processing, which gets back to the contact tracing. Like, we have to have the ability to reach out to those people and the staff to do that. So when cases get so high and we can't, I asked my epidemiologist in the height of the cases, how long does it take you to reach out to an individual and identify them through an investigation or close contacts? And she said 5 minutes to never. That is not okay. So when we are at a community spread at a level where sometimes the answer is never, and that's when we're trying and the family or person wants to engage, we can't keep up with it. And so I think, can you repeat your question to make sure I answer
My
it?
question was around the mask mandate
Okay.
and whether or not it'll continue in yellow. If
So we
can
have
expect
some
that to continue.
continuation. We have some community metrics that are indicated for when we should strengthen our order and make it more strict, or when we should back off. And so I think that would be a consideration of when we should or shouldn't, and it'll be up to our local board. I think right now we don't know what that will look like. I think that we would certainly consider it in category 2 because a mask prevents exposure in the classroom. So when someone like you all maybe want to track potential exposures as a result of an infectious person in the classroom, these are going to make your numbers look better. Because yes, they will be quarantined, but the chance of them actually becoming infected decreases if both parties are wearing the mask. So I think that it is a consideration we would look at, and I think we're still a ways away from for taking that mask order away.
Mr. Chairman, a follow-up on that?
Please.
Could we expect that you would, when the mask mandate is lifted by CDH, that there would be a period of transition time? That you might announce it on Monday, but it would go into effect at a later date?
I can make that feedback. I can share that feedback with our director and our board if that's an ask. I think it's a reasonable ask.
That would be helpful for us.
Absolutely.
Thank you.
You're welcome.
And then one last question.
Please.
Thank you. Around the contact tracing and the quarantine, so some schools are already taking place in person. If there's an exposure in a classroom, does the classroom go into quarantine along with the teacher in quarantine? Or can you just walk me through like how that is working today, or what we might expect for that to look like once we're in person?
Yes, that's a great question. So the answer is no, it doesn't have to look that way, and yes, it could look that way. So if you have an infectious person in the classroom and no one is social distancing and they're running around the classroom, I'm going to use the first grade class as an example because it's easier for me to contextualize, and they have group play, and then they go to PE and there's no social distancing, and then they go to the cafeteria and they eat at a table and there's no social distancing, and they're sharing food, kind of an exaggerating example. But anyone who is within 6 feet for more than 15 minutes of that infected person is going to be asked to quarantine. If those cohorted groups, and let's say you have a group of 20 kids in a classroom and they're in small groups of 5 and they maintain that cohort, and those 5 groups, they break the social distancing rule because maybe they circle around a table, maybe they eat lunch together, then they go to the recess play area and they have stations that they use and they don't intermix, and someone is infectious in that group, then only that person and those 4 people go home. So it's all about the level of exposure and what the mitigation measures are in place to help prevent infections from happening and exposures from taking place.
Thank you.
You're welcome.
Thank you very much, Ms. Pinnell. We truly appreciate your time here this evening. It's very helpful for us.
Sure. You're welcome.
Yeah, thank you so much. And next we have a guest, Eric Thies. He's president of the West Data Educational Association. He's also a West Data teacher and a marvelous cook, from what I understand. So, Mr. Thies, you have the floor. Thank you. Thank you very much for spending your time with us this evening. I truly appreciate this.
Absolutely. Thank you for allowing me to be here. I've been asked to present the views and concerns of teachers, and I'm going to try to do that for you. I want you to know that teachers and staff have been watching and listening intently during school board meetings. They've been reading exec team notes. They've been scrutinizing the few documents they have received through building and district communication. I've never seen union members more engaged in the decision-making process than I've seen them this summer. We listened last week to the parent testimony, and to be fair, I think the members of the WAEA agree with many of the premises that were expressed, but strongly disagree with some of the conclusions. The 3 premises were stated over and over last week. 1, families and students should have choice. 2, emotional health of students is important. 3, in-person instruction is superior to online instruction. I agree, and I think my members agree with these premises. However, teachers and staff do not agree with the conclusions that were derived from these premises. Students should have choice, but not all do. The idea that families can choose to send their children to online school is a fallacy. There are families which aren't just 2-income households, but sometimes 3 and 4-income households. They don't have the ability to support their child's education and still provide dinner each day. Not all families have regular access to the internet. We have homeless students in our schools every day. We have students that speak 3 or 4 languages at home, and none of them are English. These are all barriers to online instruction. The idea that all families can simply sign their kid up to attend online school is an illusion born from privilege. Don't forget about our most vulnerable students. They deserve to have the choice to attend a safe school as well. Emotional health is also something that concerns me. It doesn't take long to find a teacher or student who has lost a loved one due to COVID. Death is a natural thing, but when we can avoid it and we don't take measures to do so, it scars us. What happens when a student has a teacher who dies, or a brother, or a sister, or a parent? How will that affect a student's emotional health? Let's not forget to consider the lasting effect of living in a heightened level of fear and anxiety. There are adults working in schools who fear they won't survive if they contract COVID, but know their family will lose their house if they quit their job. Let's at least acknowledge there are students with similar fears. There are students that are afraid they will pass this illness on to the ones they love and kill them. They don't all have an easy out. They can't all go online. How much worse will it be for their emotional health if we don't keep them safe? In-person instruction is superior to online instruction. To be clear, teachers will work the system, and every student will learn at great levels. But this is why we need to be careful to return to in-person instruction. If we move too fast before the numbers are low and we push students into environments which promote rapid spread of COVID, then we will get shut down, and that shutdown will last a long time. It is far better to take appropriate precautions now, work as a community to minimize COVID across West Ada, keep the numbers from going up so that we can return to school under yellow or even green conditions, and have a reasonable expectation that we can stay there and stay safe. Rushing the process will likely result in prolonged absence from the classroom. Slow is smooth, smooth is fast. With all the conflicting points of view, how can anyone make a decision? When decisions are hard, I make a priority list. I'm not a lawyer, I don't want to quote state code, but I will suggest there are top 3 priorities in any school district. First, keep students safe. Second, keep staff safe. Third, teach kids something. If we can't do 1 and 2, we have no business talking about 3. With respect, you as the trustees of West Ada School District have to decide the best way to keep students and staff safe so that the staff in West Ada can figure out how to support student learning in whatever environment we're left with. I've spent months trying to understand the data and the science in order to come up with an answer about the best way to keep kids safe, and the only thing I learned was I was reminded that science is messy. It's the nature of science that until we have an answer, we don't know. Through all the mess, there was one answer that seemed to keep popping up. There are 3 precautions that, when taken, dramatically slow the spread of COVID. They are: wear a face mask, wash your hands, maintain 6 feet of physical distance. Across the globe and in our own community, where these 3 things happen, COVID numbers go down with very rare exception. And without exception, every case that I dug into where an outbreak occurred within a day camp, within a daycare, within our communities, one of these practices wasn't being followed. It may be too simple to be true, but wear a face mask, wash your hands, and keep 6 feet apart. This isn't a list that I think would surprise anybody that's been paying attention, and it does have some significant implications when it comes to our reopening plan. We must have a face mask requirement when our schools are in yellow or red conditions. Everyone who is medically able should be wearing a face mask at all times in our school. Not a face shield, but a face mask. Yes, there are times when a face shield is necessary due to medical or instructional reasons, but face shields are not nearly as effective as face masks at stopping respiratory droplets. Although CDC guidelines point this out, our plan does not. Our plan suggests that a face shield is equally useful substitute for a face mask. Additionally, CDC recommends 10 feet of physical spacing when using a face shield as opposed to a face mask. I would recommend removing face shields from our plan entirely, except when necessary for instructional and medical reasons. At the very least, include language about the reduced effectiveness and include language which increases the necessary distance of 10 feet when shields are being used without a face mask. We cannot maintain physical distancing when we have classes of 30 or more, but we have a much better chance if only half our students are in our classrooms. We cannot bring back full classes at any level and expect to stay 6 feet apart. When in red, the ability to bring back a few students at a time for specific reasons will be useful, but small groups is a relative term. In a school of 2,500 kids, 50 kids is a small group, but probably not what's intended by our plan. Clear guidance on what a small group is would be nice. I say of all of this to provide some perspective. This is the understanding that most of our teachers have. Although it varies from item to item, WAEA surveys show that over 70% of members agree with each of the things that I've said. I was asked to share the top 3 issues facing teachers with the start of school. First, communication has been seriously lacking. As a result, teachers don't know what we are expected to do. We are back at work tomorrow, and little, if any, expectations have been laid out for us. In some schools, teachers are being asked to prepare 2 weeks' worth of lesson plans by their principal, which is normally a completely reasonable request. Normally, by this time of year, many teachers have most of their semester mapped out already anyway. However, teachers still don't know if they will be teaching face-to-face, remote, or something else. We don't know what resources students will have access to, if we will be following a bell schedule, if we should be teaching synchronous or asynchronous. Many of us have seen the building level safety plans, or haven't seen the building level safety plans, and have no idea how that will affect our daily routines. Parents are enrolling and unenrolling in our schools, including the virtual schoolhouse, at an outrageous rate, which means many teachers still don't even know what grade they are going to be teaching. Teachers are planning, and right now we can't. Second, we are concerned that we will not put measures in place that will keep us safe. We don't want anything outlandish. What we can all agree on are 3 simple things: wear a face mask, wash your hands, maintain 6 feet of physical distance. So create a mask mandate during any yellow and red conditions, one that stresses the use of face masks as preferable to shields and allows for medical and instructional exceptions. Our current plan allows for physical distancing in all classrooms during yellow conditions, while still allowing for some in-person instruction. Please don't change that aspect of the plan. The third concern I want to be gentle with. I'm not trying to offend anyone. As teachers, I know what it's like to have our professionalism ignored. Laymen constantly step in and tell us how we should do our jobs. From parents to legislators, everybody knows the best way to be a teacher, until their first day of student teaching, when they learn they have no idea what it takes to be a good teacher. I would love to tell you how to do your job as school board members, but that would be an arrogant mistake on my part. I am merely offering perspective and advice. I don't know the pressures you are under. I don't know the restrictions you have. I haven't been through the trainings you have, and I don't have your experiences. In turn, the CDH knows how to handle health crises. Epidemiology and global pandemics are what they are experts in. They are charged with keeping our community safe from COVID-19, and we should trust their expertise. We don't have the knowledge, training, resources, or experience. The third concern, with all due respect, is that you will choose not to trust the experts. That instead you will try to be the epidemiologists and not follow the recommendations of the CDC and CDH. Please trust the experts. I have 3 recommendations I would like to make based on these concerns. First, do what you can to encourage and support district and building administration in communicating with staff. Try not to delay, hinder, or confuse the communication. It's time to make a decision, be clear about that decision, and stick with it. Ensure that whatever changes you need to make to the district plan, it always includes language which requires and enforces 3 safety precautions during yellow and red. Wear a face mask, wash your hands, stay 6 feet in physical distance. And number 3, trust the CDH and follow their recommendations. It is the passion of the staff of West Ada that make this district such a success. Don't let confusion and fear erode that passion. You have to realize that the commitment of the employees is the greatest commodity this district has. Don't dilute that commitment by undervaluing the employees. It's only through the efforts of those employees that this district will be able to reach its goals. Let them know there is a safe plan, a safe path to that goal. When our school board, our administrators, and our staff are all playing on the same team, this district is unstoppable. Ironically, I'm going to stop there. Thank you for inviting me here and valuing the opinions of my members. I will happily stand for your questions.
Thank you very much, Eric. I truly appreciate your time on this. Trustees, do you have any questions?
I have one.
Trustee Johnson?
Thank you. Thank you. Hey, Eric, how are you?
I'm doing all right. How are you?
Good. Hey, I'm new to this, so I wanted to kind of understand from a communication standpoint, just general information around kind of what the Education Association's membership is, kind of what represent, like, do you represent 100% of all the teaching members or a certain portion? That's one question. And then the other is, how do you process your recommendations? Do you get together and vote on them to come to us, or how does that process work?
So the first answer is during negotiations, we represent all certified staff. Outside of negotiations, we represent just our members, and all of our members pay dues. And I honestly can't tell you where our membership is right now. I can tell you at the end of last year, it was at 788. I don't know the total number of FTE within our bargaining body, or sorry, the total number of people. The total number of FTE is about 2,200. So I'm not sure where that percentage falls out. I will tell you that even today I helped 4 people join because of the chaos that's going on right now. And our membership has been climbing, I'm guessing close to 60 or 70 this summer. I also don't know how many people have resigned from the district without letting me know. And so it's really difficult for me to know right now where my numbers are at. If I had to guess, 850 to 900, somewhere in there, based on the amount of folks who have already resigned. And if I had to guess where it's going to be in a month, I couldn't tell you. I'm sorry. And then the way we decide is we've got an executive board that's elected by membership. I'm elected by membership. And through this, we've been doing a lot of Zoom meetings, actually, and we've had, members and non-members show up and talking to members and non-members, upwards of 180 folks at each meeting. And it's difficult to hear everybody's input, so we've also been putting out a lot of surveys. And the survey results, the stuff that I've talked to you about becomes very, very obvious and very, very common amongst my membership. If we wanted to talk about every concern where the majority had it, I would need much, much more than 10 minutes. But these are concerns that a supermajority have, and that I can say with fidelity most of our teachers are going to have.
Thank you. Mr. Chairman, I did have one follow-up. Oh, I wanted to know kind of the representation before I asked the second question.
Yeah.
One of the, and this is just an opinion question, kind of based on you knowing your membership. One of the things that I've been getting a lot of feedback is there's different opinions, and they've started to come in at the different levels of teaching. So the K through 5 has they have a different challenge in an online versus a middle and a high school. And so I wanted to kind of get your thoughts on what you're seeing from your membership in that regard.
There is a division between elementary and high school, but it's really obvious. Teachers want to be back in the classroom with all of their students, but they also want to be safe, and that doesn't really change by grade level. The challenges certainly change as a result of, if we open in red, the challenges for a kindergarten and first grader is very, very different than an AP teacher. And certainly when it comes to things like the 4x4 block, that only affects our high school teachers and doesn't affect our elementary teachers at all. And so I try to sort through the data and figure out if this is going to primarily impact the elementary students or elementary teachers, then what do the elementary teachers think? What I've been really surprised about is there's not a lot of division amongst the percentages. We get anywhere between 300 and 500, as high as 600, but 300 to 500 is pretty typical in our surveys. And when I do break it down by grade level, the difference amongst opinions is 5 to 10% typically. It's not typically very big. And so the challenges, and when we're having conversations about how do we handle this situation, how would we handle being in red, people's opinion of that's going to be difficult is really common, but exactly how you address and why it's difficult changes from grade level to grade level.
Any other trustees? Trustee Smiley?
Thank you, Mr. Chairman and Eric. And this is just, for the matter of the public record, you and I have had a couple of conversations already this summer.
For sure, yes.
It is something that, I've been there, done that. Back in a previous life, quite a few years ago, I was actually a head building rep. And one of the things that works so much better, and this is something I'm going to say to you personally, it is very much noted and very much appreciated that I have caught that attitude that, we're in this together. And it isn't an us versus them type of things that, the traditional labor union management approach seems to favor is, kind of this adversarial relationship. And I've really noticed that and appreciated that the attitude, at least from the people I've talked to, has been, we've got a problem, let's figure out how we're going to solve it. The budget is what the budget is. We can argue and have disagreements about how exactly we're going to slice up that pie, but that is what it is. And right now I'm a little nervous because we have a supplemental that is before the voters today, and I'm quite concerned, and if there's anybody in this room that hasn't yet voted, you may be excused to go do that.
You have 67 minutes.
But, it is something that, we can solve these challenges, and our superintendent likes to talk about luscious challenges. But, one of the things that I am concerned about is that the communication goes out. This is one reason why the board pretty much agreed unanimously that we could not open in August. Our neighboring district chose to go completely red and try opening. I haven't gotten a lot of reports back of how that's going, but I think I felt good that we bought a little bit of time, because this way, as the teachers come back to the building, we are going to have a couple of weeks with some direction, and hopefully that'll help us. There's no guarantee in life. As Yogi Berra once said very famously, predictions are especially difficult when they involve the future. And so we are literally flying this airplane and literally trying to put parts together as we're getting airborne. That's going to happen. That's the nature of the business. And I would like, to ask you, give you a chance to say, do you feel that this extra time is going to be helpful so that we can, when we make our decision, whatever color it decides to be, that we can go ahead, we can move forward and make plans?
Yes, is the short answer. I would like to reiterate that I think we have a great relationship between the association and the district administration right now. And I think that benefits everybody as a result of that. And so I also wanted to echo that, is I feel that way as well. And me being here and testifying is not a reflection that relationship is in any danger whatsoever. I still feel that we're working very well together through this crisis. And so I just want to put that out there. As far as delaying the opening, I, of course, did one of those surveys, and it was the one that had 623 responses. I was amazed by the level of interest in that. And 95% of the teachers came back saying that, yes, we want to delay the opening. And to the point where that's going to create some problems for me and Mr. Roberts that we're going to figure out next month. And I say problems, but just something we got to do. It creates a process we got to go through. But the extra days at the beginning of the year, having 8 days to get trained up on how to do remote and blended learning, that's not something that our teachers have had to practice in the past. And so being able to get that training is going to be critically important in providing a quality education. Also, the safety procedures that we have in place, we need to make sure everybody understands what they are and knows how to do them and implement them correctly. And that's going to be a critical piece within those first 8 days as well. I hope it will also give our teachers a little bit more time to collaborate together to develop these lesson plans so that they can open up on that first day of school, whether it's remote or not, and really be able to engage students at the highest level possible in that environment. And I know if we can get them together and collaborate, they'll be able to do that. They'll be able to get there. But all of those things take time. So having these 8 extra days and delaying the start of school, I think was a great idea, and so do my members.
Eric, I was curious, what do you think about daycare issues for teachers? We're hearing a lot about it. I was just curious what your opinion would be.
I think it's a serious issue. It creates a tremendous problem, and if I'm being frank with you, I'm afraid we're going to be losing teachers over it. Really good teachers have to worry about their own children as well as the ones at school, and many of our staff, especially folks who aren't teachers, are classified staff who don't get paid as much. Their daycare bill is going to be bigger than their paycheck, and that's just not a good place for anybody to be in. And so it's something that we need to figure out a solution for. I've been reaching out to a couple local businesses and seeing what they're interested in, and I mean, I've been pulling at every thread I can imagine to try to find a solution for that. And it is something that we're really going to need community support if we're gonna be able to solve that issue. I think there's some solutions in red that are a little bit easier, but I also know in yellow that becomes a real problem. And so I'm still hopeful that we'll find a solution. We've got 2 weeks to figure it out. So I'm feeling a little under the pressure on that one, but I'm still hopeful that we'll find a solution.
So just to follow up on that, I was curious, the schedule we have is an alternating day schedule. Is it more difficult for teachers to get daycare because of that alternating schedule, or is that not such an issue?
I'm not sure if it's the alternating schedule or not. What it is it's not just our teachers that need this extra daycare, but it's all of our parents as well, right? So it's not just an issue for our teachers, it's an issue for parents. And so what few resources are out there, the businesses that are offering things, if they can be afforded by teachers, there also can be afforded by other parents. And so it's kind of a struggle to even find daycare. And so the cost sometimes isn't even an issue because you can't find it anyway. If there wasn't an alternating schedule, that would probably fix some of that issue in yellow, because those kids, the K-5 students, would be in school every day. And even if there's some middle school students that still need some daycare, there would be more of it available in order to get it. So maybe there's a lot of factors, and yes, the alternating schedule contributes. I just don't know if it's the main reason this is an issue for teachers.
Excellent. Thank you very much. I truly appreciate your time on the board, in front of the board, and I really appreciate all the work you've been doing with the association.
Absolutely. Thank you for letting me be here.
Thank you very much. Really appreciate it. That brings us then to the consent agenda on our agenda. Clerk Newbold, do you have any amendments or updates?
Chairman Clappen. Chairman Kloppenstein, trustees, Dr. Reynolds, I have added all of the patron input until 4:30 today, so anything after that is not on the agenda. Thanks.
Excellent. Thank you. How many emails did we end up with?
Oh, probably 300, 400, 500.
Wow. Okay. Thank you. Trustees, do you have any changes to the consent agenda? Not seeing any, then do we have a motion for the consent agenda?
Mr. Chairman,
Trustee Smiley.
I move that we accept the consent agenda.
Thank you very much for that motion. Trustee Smiley, is there a second? Trustee Newhoff?
Sure, second.
You were going for it. Any discussion?
Mr. Chairman, just a quick discussion. I know
Trustee
this
Johnson.
year is very unique, and so I probably didn't get the kind of learning that I would have loved to get through the CIP piece, and I know we had to do it the way we did it, so I'm going to just ask for some staff support for that when we get back to some sort of normalcy, to get some really good information on how this process works. So that's it.
Thank you. Any other discussion? And if there's a motion on the floor, all those in favor of approving the motion, please say aye.
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 And Chairman is aye as well, so it's unanimous. Thank you. That brings us then to the discussion portion. And we have kind of a bifurcated discussion. So we're going to be doing the fall reopening plan category, along with the action item directly following that. And then we'll move into item 904, the discussion of policy 904 afterwards. So to start, we have, I do have a statement I'd like to read, but I think I might just hold it. I think there's a lot of concerns we have, obviously, with this, but at the same time, the concerns we're going to have regardless. So it's a very big decision. And I think to start, what I'd like to do is ask Mr. Heller, if he would. There's a few things I asked him if he wouldn't mind reviewing, one of which is just some, what they would do in to open up if we went from a red to yellow, that sort of situation, perspectives on masks, things like that. Just maybe also field some questions from the board. So Mr. Heller, you have the floor.
Thank you, trustees, chairman. I guess I would start off by saying we don't have any specific updates to our plan at this time. There was a specific question I believe that you're kind of referring to in terms of if we are in red, and then Central District Health makes a recommendation to move us to yellow, what does that timeline look like? And so we talked about quite a bit today during our COVID task force, and we said if moving from a red schedule scenario to a yellow, when they make that recommendation on a Monday, Central District Health, we would announce on that same day that we'd be moving to yellow, but that transition would happen the following Monday. So that gives us a week for transportation, food service, make sure that we have everything ready to make that transition. Conversely, if we are in yellow and then there's a change to move us to red, we would make that change within 48 hours. So if on a Monday they announce that we are moving from yellow to red, we would like to make that transition by that Wednesday, so because we're moving to a more restrictive phase, and sort of give our staff and students the most opportunity to be as safe as possible.
Excellent, thank you. And as far as the mask situation, just curious, I believe you were with the, or you heard the webinar this afternoon. And so I'm just curious, did anything you heard in that webinar, there was a webinar with the ISBA, by the way, Idaho School Board Association, and it was one of the law firms associated with the association discussed, like half an hour basically talking about masks, it seemed. And was curious about your perspective on what they said. It did sound like that legally we would have, if we require masks, we would have to provide masks. That seemed to be what the direction was. And I was just hoping to get your perspective on that.
Yeah, essentially, if the mask mandate were no longer to be in place, if it's still in our plan to require masks, then we may require masks. But like we've said, I think all along, when it comes to some of these safety materials, we're going to provide those. We have a plan. We've made lots of purchases so that we can provide those to students, and we would continue to do that as we need to, because we just feel like that's much like in a welding classroom. We provide materials that a student needs to be safe in that environment. And if we believe as a district in our plan that the mask is a requirement for safety, then we are going to provide the masks.
Thank you. Trustees, do you have any questions for Mr. Heller? Trustee Ozuna?
Mr. Chairman, thank you. Around the mask mandate, do we need as a district to put that mandate into our plan, or can we rely on the CDH mandate given the information that Gina shared today? And I guess I would ask if CDH were to pull that we could schedule an emergency meeting to make sure that we have that conversation. But do we need to make that mandate ourselves in order for it to be enforced in our schools?
Trustees, I don't believe that I think the way it's currently written on our plan is that masks are required as currently mandated. So to your question, if that mandate were to go away, the board would have an opportunity to come together and decide what they would like to do in terms of the mask mandate going forward as a district post a CDH mandate. So in terms of us being able to operationalize and use and enforce a mask requirement in our schools, we believe the way the plan is written currently allows us to do that.
Okay, because a follow-up. I just want to make it very clear that I am in favor of a mask mandate in red and yellow, and feel very strongly that we need to have that. And I think as a board in general, the majority are there as well. And so I don't know where that confusion landed. And so that's why I'm just asking if that's something that we need to make more clear in the plan. So that's the reason for my
I
question.
would take any recommendations. If there was a recommendation to make it more clear in the plan, I believe our building principals, who are the ones that are going to be asked to pull this off with their teachers, they are very clear that wearing masks, washing hands, and keeping as much physical distance between individuals in the buildings is the plan, and that we're going to do as much of the physical distancing, as Eric Thies mentioned. It's not going to be perfect, as Gina mentioned. Little kids, trying to keep them physical distance all day, there's some challenges that are going to exist. But 6 feet, 15 minutes, wearing masks and washing hands are the three things that we're expecting all schools to do at every level.
Trustee Smiley?
Thank you, Mr. Chairman and Mr. Heller. One of the things that I perhaps have a benefit for, 7, 8 years, I was in charge of morning cafeteria duty. And I had a female aide that was also one of the supervisors. And we had a routine. She would take care of the situation with girls. I took care of the situation with boys. And if a kid came in with a beer t-shirt, very quickly, into the coach's office, here's a school t-shirt, you may change right now. If you have a problem, we'll call mom. Same thing with the attire for the girls. The female aide took care of this. And I kind of think that if this is part of our policy, it'll be that easy. If a child shows up without a mask, they'll be said, you do need to wear a mask, and if they refuse, we call home and say, you need to come pick up your child. This is how we've handled other attire and, things that we've deemed to be inappropriate as far as our rules and standards. Would you see this as falling under the same category, or as a board, would we have to make specific mention of hand washing, masks, distancing?
Again, I do believe that in our fall reopening plan, in our building plans, those are the expectations. I know that as I've looked at building principals and the PowerPoints that they've been putting together for their first day back with staff and starting to meet with staff and go over precautions, they are talking about those very things that you're mentioning. So where they're going to station staff members throughout the building, not just for mask wearing, but also to encourage hand washing and to encourage physical distancing and to keep students moving through the hallways. So it's not just a business as usual plan. They are looking for every way, like they do every year, to increase the efficiency of their operations and make sure that these mitigating measures are in place in every building. So I have the utmost confidence in our building admin team and those teaching staff that once given the opportunity to put these plans in action, they're going to not only do them well, they're going to do them fantastically well, and they're going to do like they always do. They're going to identify holes in their plan, and they're going to fix those holes, and they're going to get better at it every single day.
Thank you.
Thank you very much. Trustee Johnson?
Thank you, Mr. Chairman. Brett, I'm going to ask the question a little bit different way. We just watched down at the Capitol on Monday some very interesting behavior around wearing a mask in a mandated area. So if you were to experience something like that in our schools, what kind of enforceability do you need to do it? And do you think you have it?
I think when we start talking about things that go beyond just a student not wearing a mask and it starts getting into incorrigibility and insubordination, then we have things in policy that are written to allow us to take care of those things and enforce them at a different level. That is not our expectation, but we have it in policy within our student handbook to deal with incorrigibility and insubordination when it rises to that level. When it becomes just a student not wearing a mask and we have to have some education and we need to talk through it with the parents, we know we can handle that. When it gets to a different level, we have it in policy and in the handbook to allow us to address those larger scale levels of insubordination and incorrigibility that might happen in a school.
Thank you.
Trustee Newhoff?
Thank you, Mr. Chairman. I really wish this discussion wasn't all about masks, but I'm going to follow up on it. I mean, because as I said before, I thought our plan was pretty clear that it was mandated, and I don't know why people keep promulgating that there's ambiguity there. But getting back to some of the points that Mr. Teese raised, there's this question about face shields, which Dr. Fauci thinks you ought to have in addition to a face mask.
Right.
There's some ambiguity there, and there's some other ambiguities in some of the other documents that have come out. For instance, we got a transportation document draft or something this week that didn't say that masks were required. I can't remember exactly what the wording was, but it was far less definite than that. And I think that's part of the problem here is that, you know, there's many documents and things are being generated here, and the word encourage mask use, that creeps into a lot of them. And there was this discussion about the face shields versus the face masks. And I mean that you know what I'm talking about. Sure. So I guess, can you address where you view the concerns that Mr. Teese raised about face shields is? I mean, my biggest concern about the mask mandate is that it's not strict enough and that we aren't mandating masks that actually work.
Sure.
I mean, because I can see a whole bunch of kids coming with outlaw bandanas that are ski buffs, you know, and they're actually worse than not wearing a mask. So, but anyway, I mean.
So, Chairman and trustees, in terms of the face shields, our plan for the most part in terms of any face shields we have ordered have been for very specific groups of students. And Mr. Thies mentioned there are certain students who within their learning needs, because of their individual education plan, they need to be able to see the lips, the mouth moving of the instructor, or the student needs to wear one so that we can see that. We've also been working on face shields or face coverings that have the clear plastic window, so we've been looking at some of these different options that exist. Choir is an example of a place where we are looking at the use of face shields to allow for singing to happen, but we are increasing the physical distancing as well as wearing the face shield. So it's not face shields at 6 feet, it's going to be face shields at 10 feet. And so I think the reality is, and we've talked about this, is there are going to be times when the face shield is appropriate, and there's going to be times when the face shield is not appropriate. Our health services supervisor, Tracy Garner, has put together a mandatory burst of, it's a PD term that we like to use, a mandatory PD session that all teachers will be watching over the next 4 days during one of their PD sessions, in which she actually goes through, if you are wearing a face shield that opens at the bottom, how close can you be to the person that you're working through? Where do you need to position yourself in the classroom if you're wearing that type of a face shield versus a different type? So training our staff on how they utilize the different face coverings is part of this process as well. So I think it's like, as you said, it's hard. A lot of the conversations are about face masks. And what I worry about is we put too much emphasis only on the face mask, and we start to forget about the 6 feet and 15 minutes, and we start forgetting about the hand washing. And so we have to continually talk about all three of those things together. If the board wants to change language or make recommendations in terms of language, in terms of face masks, we can certainly entertain those changes and bring those forward. And that's something that, if there's a recommendation to make the language stronger. In terms of the bus, it was my understanding that they were going to follow the same mask requirements as we are following, but I will follow up with Mr. Updike to make sure that the language in that draft document is reflective of that, because that is the expectation, is that when they're on the bus, they are wearing the mask as required in the schools.
Thank you very much. Trustee Ozuna, do you have a question?
No, I was just going to follow up on that situation with the bus. Actually asked a question around that, and so I got an answer, and the answer was, it was written that way, so if the CDH order goes away, then masks are recommended as opposed to required. And given that, I do think it might make sense for us to put just a requirement in our plan to make it very clear where we stand on it, that we can revisit at a later time. It's something for us to think about, because that is an area where, it did not work as we intended.
And I would agree that with a mask mandate currently in place, the way our plan is written is probably fine in terms of the overall operational plan, but if the board would like us to make that stronger, especially if and when the mask mandate goes away in our community, then we can certainly have that conversation.
Trustee Smiler, do you have a question?
Mr. Chairman, Mr. Heller, you bring up a very good point, and that is Cascade Transportation hires its own employees. And, you know, I'm just curious, and maybe Mr. Updike could help or whatever, but how are we working with Cascade, especially because a lot of our drivers are people that have retired and kind of use this as a second income. And are we installing like plexiglass shields in the driver's compartment, or you know, what other arrangements are going on with Cascade? And here again, I don't know the answers to that question, but you know, I do know that when we've traveled, I've been some places where they've actually installed some kind of a shield between the driver and the passengers. I'm just wondering what's happening with Cascade on that. Do you know?
And I'll be honest, I don't, and that's kind of, that part is more on the operational side of the house, and Mr. Yoakum and Mr. Updike would answer that. I don't know. I do know that Cascade has worked very closely with us, and Ian has served as a great liaison, and they want their plans to mirror ours as much as they can. Obviously, there are some very unique differences on a bus route, and I know that he has sent you some information in terms of how long students are spending on the bus and where we are in terms of route coverage. But I don't know if they've put in, I have not heard of any plexiglass barriers being placed in the buses at this point, but that doesn't mean that it's not something that they're considering.
Yeah. Because just to follow up, the other thing is I do know that the plans have been, you know, in a lot of the buildings of sending the message to parents, if at all possible, you can bring your children to school. We're, especially through this, we're encouraging that to happen, because every single building I've ever been in has a bottleneck. And every single school bus has a big bottleneck. They all have to come up the steps and come past the driver. And that's just the nature of it. And if there's 60 kids on the bus, it's a lot different than if there are 20 kids on the bus.
And I will say, trustees, that the alternating day schedule, when we built that into our yellow plan, part of that was with the transportation in mind. And our meeting this morning with the COVID task force, that was very clear that all of their plans have been built around this idea that in yellow, they would have a reduced number of students on the bus, which allows them to do more physical distancing.
Thank you.
So we kind of like to follow this discussion a bit into the different variables we have for actually deciding the item in front of us, which is what category to go into. I see at least two items that we really need to discuss. How exactly what category to go into, and what exactly, how to do that. The trick obviously is we're going to have for actually entering into a category is that as CDH, as Ms. Piniella said from CDH, that is very possible we might go into a color and then transition very quickly out of that color. So we wouldn't have much time in that. So there's some thoughts around that, and I think that's a definite issue. There's also the issue of are we as a board going to get back together, or can we make a decision on how we're going to do that tonight? One other thing I'd like to maybe talk about is just a discussion on sports. I've had the pleasure of being able to talk extensively on sports this past week, last week with Jason, our AD, and it gave me great confidence about what we're doing. Ms. Piniella also gave me good confidence about what the sports plan is doing and how we're actually getting together for sports and practice. However, again, how does sports work and how does it look within these different conditions? Wouldn't be a bad thing to discuss to see if there is something that might shade how we're actually talking about category. So those are the two things I have. I'd be very curious to see from trustees if there is another variable you're looking at that we need to discuss tonight that gets us to our point about category. Trustee Newhoff?
I guess the one variable I look at for how we open up, in addition to what you're discussing is the need for a little bit of consistency. I mean, I think that the idea that, okay, I mean, I'll play my hand here. I mean, my vote would be to go to remote learning, given where we're at. But let's say CDH does go yellow in the next 2 weeks. I don't see a lot of benefit from a disease mitigation point of view or really helping our families with consistency to then say, okay, well, we're going to be remote for a week and then we're going to flip into yellow a week later. I mean, I think a more consistent induction period where maybe we're remote for 2 weeks or something. So there's some certainty, at least, you know, for some time out as we, you know, move on. I think that's another consideration to at least think about. As you know, and as we can think about how we're going to be moving potentially between different categories. And I don't want to be in red any longer than we have to, but I think kind of going there and having a week in red and then moving into yellow after just a week of school may be a little bit of a tough deal. And you know, especially given sort of the, you know, this kind of time average approach where you think about the epidemiology. I mean, you know, so you're in yellow, you don't want to open up schools and then pop right back in red the next week, you know, I guess. So anyway, that'd be one consideration I would think about.
Excellent, thank you. You know, it's funny actually you're saying that because Ms. Pinnell, and I apologize, Brett, if you're standing up there, would you like to sit down? I would love to be able to call on you, if that's okay.
Absolutely, and I've also, Mr. War is here as well if you have questions specific to athletics, so he's here.
Wonderful, actually. The reason I'm curious is that I have to admit the big challenge, obviously, is does it, we're kind of guessing when it comes down to, Trustee Johnson always knew the answer there. Always solution-oriented. If we pop into red, does that then harm our parents? Does that create an undue burden on our parents? They have to then deal with daycare and situations. Our teachers then have to teach remotely for 2 weeks or so. I mean, is that an undue burden? I have to admit, I'm frankly of the idea to, if CDH says red, it's red, and I'm okay with that. But if we have this unfortunate little possibility out there that we might suddenly go yellow after just being, you know, red for a week, is that then become a challenge that becomes quite a burden on our families?
Mr. Chairman, maybe
Trustee Johnson.
maybe since I'm sitting in between you, I can blend the lines. How's that? So a couple things. One is that, and it's something that Trustee Ozuna said about us providing, I want to just go back one mention on the masks. I've been looking at all the documents, right? And we've got the State Board of Education document, we've got the Central District Health data, we've got our reopening plan. And the starting point for everybody has been that State Board of Education document. And one of the things that they built it in June, so understandably things have changed since June. But one of the things in there is that masks are only recommended in yellow. So I think we have to understand that because that may be creating some confusion for folks because that's where that's kind of been the North Star. So that's just an information point. When it comes to the categories, I think I've been kind of considering the same things. Like we've got category red, we've got category yellow, and how we bounce back and forth in between them, which is why the question around mitigation. Because the mitigation process and protocols that we put in place allows us to have more flexibility within those categories if we do it well. And so as I think about, I'm actually with kind of in line with both of you, but in different ways. So I'm in line with a red from a standpoint of the Central District Health category, but I would apply the how a little bit differently. And the how is really kind of broken up by the educational piece. And so to start slow, I guess I would think maybe our how could be to do some alternating days with those categories of kids that are in K-5 that are harder to teach online. Frankly, they're not harder to teach online, they just haven't ever done it before, so we haven't trained them on it yet. So the alternating day gives some time for that to happen. It also gives us some time to test our mitigation protocols in the most potted population that we have. And then stagger in, start slow like the folks have recommended, stagger in if we continue to be in a yellow, stagger in the middle school and stagger in the high school. But it allows us to provide some consistency, but start slow and, I think kind of move in both directions. So that's I've been kind of blending that, thinking about all the different data and points that we've been looking at.
Excellent, thank you. Trustee Smiley, do you have thoughts on this?
This is the first time since I've been on the board that I actually typed something up. It's only 2 pages. But this is something that I've been at this a long time. Years and years ago, I took a 38 service revolver out of the back pants of one of my students. God only knows if somebody hadn't come to me and said, so-and-so was bragging on the bus that he brought a gun. I have no idea what would have happened. And thank God there was another student that said something. I just did it instinctively. I didn't even think about it. There was, the resource officer was there, and we had plenty of backup. But, that has shaped my thought. This is a different kind of a threat, and I love reading Shakespeare. I'm going to start with a quote from Henry V. Upon the king, let us our lives, our souls, our debts, our careful wives, our children, and our sins lay on the king. We must bear all, O hard condition, twin born with greatness, subject to the breath of every fool whose sense can no more feel but his own ringing. What infinite's heart's ease must kings neglect that private men enjoy? Well, we don't have kings anymore. We have a constitutional republic, and I've noticed when the decision is popular, the higher up, the more they want to make the decision. When the decision is unpopular and potentially dangerous, they tend to want to pass the buck down to, well, guess what? We're the king. We have a decision on our hands. It's not an easy choice. We've heard from many parents who want their kids back in school. We've heard from many teachers, especially some who are maybe mid-career or nearing a retirement or have a medical condition of some kind, who are especially nervous. We have heard from community leaders. We've heard from medical professionals. We've, of course, heard from all the social media types. And we have to weigh all of that input, and it's a heavy responsibility. There are some who've tried to make it into a liberal versus conservative argument, or a Republican versus a Democrat argument, and I don't see that at all. I see children as children. Excuse me, I've dedicated my life to other people's children. This is not something I'm saying easily. I retired in 2009, and you'd think I'd had enough. I spent 4 terms in the Idaho legislature. I've heard all the debates, but I've never seen anything but what I saw on television yesterday. I do this for one reason. I love this community. I love our children. We have amazing staff.
And we live in the greatest nation on earth. I've never had a day that I didn't feel challenged, but also that I didn't feel fulfilled. But I don't think any of us have ever tried to negotiate an entire school district with 40,000 children through a pandemic. We aren't alone. We are led by excellent administrators. We have a dedicated superintendent. Most of all, we are supported by a staff of highly qualified teachers and wonderful people, from our food service people to our nurses, to our paraprofessionals, our bus drivers, classroom aides, coaches. I know I'm leaving off someone. We've all been inundated with emails. I know most of you have tried to respond. I appreciate the work that Clerk Newbold has put into it, the work that Troy has put into this, so many of our other professionals that have come on board and have done such a wonderful job. But today, we get to play the king. I don't know how my fellow trustees will vote. I have not discussed this with any of you. I will say one thing, that I promise right now that I will support whatever decision we make. If it be red, if it be yellow, I will support that decision, and I hope the rest of you will be able to say the same thing. My gut feeling, though, right now, and here again, I am subject to the opinions of the rest of the board. My gut feeling is that we consider opening in yellow, and I'll tell you why. The first thing is, I believe that we need to make some kind of a statement that mask wearing, social distancing, hand washing is part of that plan, and a specifically enunciated part of that plan, so that we make sure that no one questions that that is going to be something. If your child is going to be in school, those are the rules. Just like we don't want kids wearing beer t-shirts or low-cut halter tops, this is going to be part of the rules and the requirements: the hand washing, the social distancing, the wearing of a facial covering. Second, if we do receive a confirmed case of community spread inside one of our buildings, that we authorize our administration to move quickly. And if it's a single building, if it's several buildings, that we give our administration the power to do just that, to shut things down as quickly as we can physically do that. We've done that in the past in rare occasions with snow days or, an outbreak of something in a particular building. We've done that in the past. It's pretty rare, but we have to look at that possibility this time. Third, I think that we should make sure that our principals understand, and I believe they do, that we have to be accommodating. We have to accommodate requests from parents to make sure that all their kids are in the same group. So they're all in group 1 or group 2. Or if we have situations with faculty and staff and they have to have the possibility of maybe keeping a child in the building, that we figure out how to get that done. That's not going to be easy, and it's not going to be a one-size-fits-all. I understand that. And that will be a challenge. And it's going to happen eventually, whether we do it September 8th or we do it October 8th or we do it sometime in March. That is going to happen, and we're going to have to make that transition. I think we have to be generous in granting leaves of absences with staff that are having trouble, that we show as much flexibility as we can with our people, because there is a lot of unknown here. And, you know, I don't know about you, but I've heard a lot of people that are genuinely uneasy. And I don't know how much of that is exaggerated. I don't know how much of that is legitimate. This is something that none of us were around in 1918. So, you know, it's something we're making up. Fourth, I think that, and I really am glad that I talked with you, Superintendent Reynolds, today, and you were out making the rounds. And that is great, because I think that's something we're going to have to commit ourselves to doing, is to make sure that we keep our ears as close to the ground as we can with our various buildings, that we make sure that the hand washing stations are there, that we make sure that there's social distancing going on, sanitation protocols, and knowing that we have little unique bottlenecks in every single one of our buildings, that we're aware of those and that we work through those. It may mean some changes in procedures. You know, that's something we have to look at. I know that I can remember going into Hillsdale several times and dealing with that. There was some particular bottlenecks in getting in and out of Hillsdale, and that's something we're going to have to work through. You know, and there are other buildings that every one of them has a slightly unique geography. That's something we're going to have to work through. Fifth, I think that the points about communication, with me at least, are very well taken. There's a proverb that says, if the trumpet give an uncertain sound, who shall prepare himself for battle? Our communication has to be clear. We have to tell our community what we are planning to do. And we've laid out our plan. We do have the red, the yellow, and the green. But I think as of tonight, whatever we decide, the communication has to start immediately. We have some time that we bought. I think it was very wise that we waited until September 8th to open. I think this gives our staff, this gives our administration, this gives our families some time that they will know what we were planning. I think that we also need to be generous about our virtual schoolhouse. There may be more families that decide after the deadline, which is supposed to be tomorrow. We may need to extend that deadline. We need to make sure, and we need to have the flexibility. We may have staff that are interested in working with the virtual schoolhouse, so because there might be more families. I don't know. I don't think any of us know. But I think that being flexible with the virtual schoolhouse, if we do any kind of opening other than red, needs to be part of those plans. And finally, I think that we all need to acknowledge that these are quite exceptional times. That as community health guidelines change, we have to be ready to change. And we need to be as we have been, we need to continue to be in contact, and we need to work with the health authorities as we have throughout this crisis. I realize I spoke a little long, but this is something I know all of you have felt the same way. We've probably lost a little bit of sleep over this. And our input, I have never been in a situation where the facts, as Mr. T said, thank you. The facts are all consistent, we agree with that, but the conclusions sometimes are quite divergent. And that is an issue, and I want to make sure that we commit ourselves as a board. And here again, I am not going to even dream to suggest to you, my colleagues, how we should vote on this. I'm just telling you what my feelings are. And I also promise that I believe that we will work through this together as a team, and whatever we decide tonight, I'm making that commitment that I will abide by that decision, and I will support our staff and our administration in every possible way that I can.
Thank you, Trustee. Thank you, Trustee Smiley. And that kind of goes back to a lot of us. I mean, obviously, this is a very emotional issue, and thank you for your thoughts. Really appreciate that. I think that one of the biggest challenges, unfortunately, for us is, this is not an end. This is just a milestone, one of many milestones. We'll be doing this throughout the year. So I think that one of the things that is a challenge for us is to, obviously communication being a challenge, I totally agree. Concerned about how to handle the community spread within the buildings and such. But I think for tonight, one of the concerns I have is how we enter yellow, being that there is, there is a concern from the community, and I do think we have to address it, which is that are we adhering to CDH rules, CDH guidance, and within that, how quickly can we pivot should there be a switch to from red to yellow, say. And as a board, it takes us at least, could be 24 hours, we could have an emergency meeting, things like that. But what I would like to suggest, and it's actually something we did in March, and I'm not sure how the board would feel about this, is if we had decided, because the guidance is so obviously fluid, there's no firm guidance that we're in one state or the other, we're kind of in that gray area, unfortunately. Would it be a concern for the board if we open in red, or if we say we're opening in red, but CDH changes their guidance between now and September 8th, and we give Dr. Reynolds the permission then to switch to yellow, basically on decision from CDH? Would that kind of guidance be a problem for the board? Because again, it's very possible, no one has a crystal ball. It may be that we stay in red, we don't know. But would that kind of a course be a problem for the board? Trustee Johnson.
Mr. Chairman, maybe I'll start because I don't think it's really about, I understand the question, but I think it's not really about that. When I think about this, I think about what do our parents and our families and our students need. Mm-hmm. And I think we have to make that call tonight and then stick to it for a little while. Because there's a whole, what I did was I went out and visited with a couple principals in my area. And one of the things that was very clear to me is that pivoting back and forth is not going to be really effective for us on the opening. We need to give some good guidance right now. We need to give some really good, and then we need to stick to it for a little while and see how it works. So while I understand, I think where you're going, I guess I would say that that question's too soon yet. I think the first thing is we have to figure out kind of where we're at and what we're going to put out in communication and then let that go. I don't think there's anything in our policies right now that stops a school from being closed because there's a case, right? So, or that situation being handled. There's nothing that stops that from happening. It's really around the transition of how we move the whole district, right? Mm-hmm. And so that's, I guess I'm concerned about that question being asked first until we know kind of where we're going. And I think we have to give some stability and communication first to do that. Well,
we're here. We're at this point of decision. There is no other discussion. I mean, we have to start deciding. So, I think at this point, where do trustees feel comfortable landing? Trustee Ozuna?
I came in tonight wanting to make sure that we outlined a couple things. And the first one is, what is the criteria that we're using to open? That was really important to me. I was hoping that we could get some more clear guidance from CDH on that. And it sounds like some of those more clear metrics will be coming in the future, but they don't have those for us to use today. Because I'd like to be able to incorporate something like that into our own plan so that parents know what to expect and they can watch those numbers as opposed to just where does CDH fall. So, I guess we'll wait and see on that, but I do believe that we need to give our parents some information around the criteria that we are using. So I hope that we can think about that. The other piece of it was that I wanted to make sure that we made clear what the timeline was going to look like. And Mr. Heller talked a little bit about that, but if we were to open in red and this were to happen, this is when we would go to yellow, or if we're in yellow and the recommendation goes to move to red, this is kind of what the timeline looks like, and we can talk through whether or not that's enough. So given the conversation that I'm hearing and what CDH said and their probability of moving to yellow, that might be something that I could support, but I would still want to understand then, what is our criteria? And do we have criteria that puts us in that yellow category? Or what would our criteria be then if we're not following CDH in its entirety? What is our criteria to move back to red? Because I do think that that's something that we need to have and we need to look at.
I'm not sure how other trustees feel, but my criteria is CDH's criteria. That's the only criteria I'm concerned about. Trustee Newhoff? Okay, you want to say something?
Yeah, and I think that's right. I mean, whatever we do, we have to acknowledge what the call is. I mean, I'm a little, sounds like there may be some movement in how the epidemiological calls are going to be made, and CDH will work that all out. But we also, I'll remind everyone, have a decision point under red and yellow. And so even if we're in yellow, we have the option to remain in remote learning. And I guess one of my big concerns here is with a scenario where we are adaptive before the 8th of September to CDH, to what's happening epidemiologically and what category CDH puts us in, is that our staff is going back to work tomorrow, right? It's tomorrow, I think I got that right. And they need to plan for something. They need to know what they're, 8 days, I wish it was 20 days, Mr. Teese. Because they've got to plan for some sort of learning environment. And there's a whole bunch of other planning that I think is going to have to go on in the background. Let's say we opened up in red. I would think that Mr. Teese, who's a science teacher, is going to be sitting there thinking about all of his lab exercises and how he's going to run those, each lab in his, teach physics as I recall, each one of his physics labs. All that stuff's got to be happening in the background, and having a situation where, well, I'm planning for, they're saying we're in red now, but we could open up yellow and I could have this other, combination of asynchronous and and live instruction stuff. If I was an instructor, I'd like to know one way or the other for a little bit of time to start, I guess is kind of where I'm at. And our community wants to know one way or the other. Half of them aren't going to agree with what we do. I don't know, if we go yellow, I think the whole community probably doesn't agree with it, because they all seem to be on one, either red or green, and I don't know. But, I guess that's kind of where I'm at, is I think that we need to provide the community, we need to provide our employees with some certainty, one way or the other, about what's going to happen for some set period of time. And we have the flexibility built in. We're not going to be green. We know that, right? We're going to be yellow or red. And we actually have the options, and I guess it's the board's decision about how to do that, but we can't operate full remote under our plan in yellow, I guess is, from my stance, the point I'm trying to make here.
Excellent. So one of the things that Trustee Johnson had brought up was actually gradually kind of merging over, and that might give consistency. Is that, I think actually that's something that the Boise School District is considering this evening. Is that something that would be a path? Trustee Smiley? I'm sorry.
Yeah,
Sorry, Trustee Smiley's first.
Mr. Chairman, I would agree with Trustee Newhoff. I think we need to make a call. My call would be yellow. Your call might be red. Whatever we decide, I think we need to decide it, come together and say, this is where we're going. People need the clarity. Mm-hmm. And that is not, it is not fair to try and, buy more time upon the king.
Trustee Ozuna, I'm sorry. Please go ahead.
I think that Trustee Newhoff is right, and people need a period of time to plan. And I also really believe that our students are better the sooner we can get them back in the classroom. And I believe that our safety plans are well done and are going to keep our staff safe, and that we have protocols in place. And if we need to provide a chunk of time to plan, and if that were to put us in a yellow category for 2 weeks while we're remote, then I would lean toward opening in yellow.
Mr. Heller, it looks like you have something to say.
Thank you, Chairman and trustees. A couple of things I just would say is, we would agree that a decision needs to be made tonight and communicated clearly to our public, and then there needs to be a clear window of time in which that designation will be in place so everybody can plan and be prepared for that, whether that is a week, whether that's 2 weeks, whatever that might be. Additionally, one of the things I think the board has to think about is, does this board want to come back every time there's a discussion about whether we're changing a color designation? I know many districts have said, no, we're going to give the authority to the superintendent to make that call based on the plan. That's something that this board needs to probably consider as well, because as those color designations change, how often are we going to bring this board together to make those decisions, or is that going to be something that's decided upon by district administration? How is that going to work? So I think those are just elements that need to be considered. I also got some information back from Mr. Yoakum. They are not installing the plexiglass shields in the buses, and they are requiring the mask mandate as long as the mask mandate exists in the buildings.
Trustee Smiley.
Mr. Chairman, I would concur, and I think that whoever of us decides to make a motion, that I think giving the authority to the superintendent to do exactly what Mr. Heller suggested would be part of any motion that I would support, is that we authorize the superintendent, if conditions warrant, to make that call. And of course, at the next regularly scheduled meeting, we would, ratify that and confirm it as well. But I think in this kind of a situation, I don't like the idea of taking your race car down the straightaway and seeing that the big hairpin turn is half a mile away, and you have to hit the brakes right then because it takes that long to slow down the car. That's no way to go. You have to be able to hit that brake before you get to the hairpin turn. And I think that authorizing the superintendent to take that action would be something I would absolutely support, no matter what color you and my colleagues, we all agree on. In the famous words of Ben Franklin, we'd better hang together or we surely will hang separately.
So I guess kind of before it sounds like we're kind of moving towards a decision here soon. I would like to suggest one thing. I have been talking to Karen Echevarria from the ISBA. As you know, she said that if we move towards a category that isn't in line with what CDH is in line with, then it does represent kind of a legal peril. And I just do want to throw that out there. A little bit of a concern for me, just because as long as if we choose to go in yellow, and CDH is saying that's a good choice, we're working with CDH to go in that direction, I'd be a lot more comfortable. However, since they gave designation as red on Monday, and we're assuming they're going to give yellow on the next Monday, but we don't know. I would be a little concerned about that, especially because we are a district which few funds, and if we actually do face a legal issue, it would be difficult and potentially devastating. So I do think that the fiduciary responsibility we have, it is something we need to consider. And I think also it goes back to sports being another issue. One of my concerns, actually, and I just want to throw it out there, one of my concerns before even last week was that sports represented along those lines, partly because a lot of what we're doing is more towards the governor's direction than IHCA or IHSAA. But it's definitely within CDH, and I feel very comfortable. I just want to make sure everyone does as well, that sports is something that CDH has given strong guidance to over the summer. I've had this discussion with Ms. Pinnell. I've definitely talked to Jason about this at length. And it seems like it's something that has been strongly considered. However, what does sports look like in red? We haven't really decided designation. If there is something we are looking at in red, it would be something that we need to voice our concern about. Again, I feel very comfortable with the path we're following. I just want to make sure that the board does as well. With that, would you like some time, maybe 5 or 10 minutes, to think about a motion before we head into that portion, or is there something else you'd like to say?
Can I open up additional discussion on
Please,
athletics?
absolutely.
One of the things for me when I have read through the plan and how athletics falls into that, I think it's pretty confusing a little bit on what do athletics look like in red? What do athletics look like in yellow? We've been in red for most of the summer and athletics are taking place. I know there's some question on competition, but I would like to take the opportunity to number one, know exactly what that looks like in our plan, because I think our parents and families and I mean, everybody needs to know what that looks like. But I would also like to suggest that we be more clear in separating a decision for athletics separate from our decision related to whether or not we're in person or remote for school, because to me, those are two completely different things. When you're talking about putting small pods of students together that have been successful over the summer and they're smaller pods versus, you know, opening up larger chunks of schools with larger pieces of kids, I just think that it's two different conversations, and I think that it might make sense to separate those.
Mr. War, are you in the room? Always ready.
Yeah.
So I guess, Mr. Ward, what some of the questions we had, we kind of discussed was really what does it look like in different colors? And I know you have a kind of an alternate, but expanded plan that you're looking to bring eventually to us. What is your view as far as how you handled the summer? Maybe we can discuss that first. What happened during the summer and your views on that? And then what do you see if we fall in between a red and yellow guidance from the district?
Okay. Chairman
From the board.
Klopfenstein, board members, Dr. Reynolds, thank you for the opportunity. You know, we've been running our programs through the summer. We felt we had some great success. We ran approximately 2,600 students through summer programs. We educated our kids. We put in mitigating factors, hand washing, masks, those things. And we did have great success. We dealt and we addressed COVID cases, whether it was from a family member that had it and the kid had to stay home, whether it was a student that was diagnosed with COVID, but we addressed it and we dealt with it. We're gonna deal with it. We're gonna have that conversation. And we know another school district we've seen in the news that they dealt with it. I feel for them and I understand it. The contact tracing we've done, we just have to figure out how we coexist. So with saying that, we had great success with our program this summer, and that's why we're confident in where we're going. We know there'll be hiccups. We know that we'll face bumps in the road. Our current plan is we're following the Rebound Idaho, the governor's plan. And in stage 3, we can have groups of 50, we can practice and continue to go forward. We kind of tried to foresee where we were going to be, and we assumed that there was a good possibility we could be in yellow. And in yellow, we had determined that we could play competitive games. With now the situation we're at, the decision comes back to what can we offer our kids if we are in remote learning? And I guess I would just mention the fact that in remote learning, our kids can get an education. And they have the opportunity to learn. It's a different type of learning, but it's learning. Extracurricular activities and the emotional and mental well-being that it offers to our kids, or the stability that it gives to kids, we kind of lose that if we don't have some kind of opportunity. So within that, in yellow, it was pretty easy. We kind of defined what we could do. In red, our early discussion was to just continue with practicing and hope that we'll get to that point. I don't think anybody here can forecast or can look forward and say, we're going to be in yellow from this point to this point to this point, or who knows, we'll be in yellow, or we could go from red. And so then the question comes back to, if we start and stop at all times, is that the best thing for our kids? So if we do go into remote learning, I think within CDH's plan, we could look and say, could we do competitions? But we hadn't got to that point because we were looking at the yellow piece. But I'm always going to advocate for our kids and extracurricular activities. That's my job. That's what I'm supposed to do. And so I feel we've done some great things, and I'll continue to push for that until probably somebody tells me, hey, we can't do that. And we'll put our safety of our kids first, safety of our coaches as a priority, and that's what we've done so far.
Trustee Smiley?
Mr. Chairman and Mr. War, thank you for mentioning that, because, when we talk about athletics, there is a heck of a difference between cross country and football.
Correct.
Social distancing is quite a bit more easy in one than it is the other. And the other problem that we have, because we have games scheduled with Canyon County districts, with Boise schools, with, literally all across the SIC. And if every single one of these schools is in a different category, how in the world do we go play Nampa in a football game? Or how do we go play Timberline in a volleyball game? The nuts and bolts of that are pretty daunting, and I'm curious to know what you're hearing from the other athletic directors in our neighboring districts that we have tentatively scheduled in not just football, but all the other fall sports, and then moving into the basketball season, which is a completely different setup in a enclosed indoor setting as opposed to football, which can be played outdoors, and we can absolutely limit the stands to, guarantee that we only have a few people there in the stands, maybe just limiting it to parents, and that's it. How do you plan doing that in working with the other athletic directors?
Chairman Klopfenstein, Trustee Smiley, great question. We've already started to work on that, and you are right. We are in a situation where we're looking at different districts. Every district in the SIC wants to do what's best for their kids. We've probably gone a little different paths, and that's where we're at right now. We can't change that. It is what it is, but we're very respectful and want to work with one another. The good thing for West Ada is we have 5 schools, and we can compete against each other. CUNA is scheduled to play a game this coming week, hopefully if the air quality is good. So here we have, three districts that are in Ada County, and we see 3 different things that are kind of happening. What I would recommend is that we just continue to push forward and do what we can do in West Ada. If that's, play the teams in West Ada, we will. We will work with the other schools that can play in the Boise School District in Nampa, but we're also aware of their situation. And that's the difficult part, but I was hired to take care of the kids of West Ada, and this is what we feel is best right now, is taking care of their needs and doing that. So we'll make it work. There's going to be bumps because you're right, we just have 5 teams.
Yeah, but thank you, Mr. Chairman and Mr. Ware. That's precisely, the thing is. So, then the question is, because I know what will lead the sports broadcast on every station in the Valley is, will Rocky Mountain High School play football? I mean, unfortunately, that's sometimes how it gets translated.
Yeah.
And so, will Rocky Mountain High School play football?
Chairman Klopfenstein, Trustee Smiley, our goal is to let our kids compete and to play sports. We understand there's a daunting task in front of us. And as we move forward, yeah, we would set a goal that on this date we could play games. That's with the support of Central District Health in helping us create a plan. It's with the support of our executive team, our coaches, our building athletic directors. I'm an optimist. I'm going to say yes, they will. Are we going to face hiccups? Yeah, we're going to, but we're going to deal with them. And some sports are easier. And you asked about winter sports. We've truly just focused on fall sports because it's one task at a time right now, and that's where we're at.
Yeah, Trustee Ozuna.
Go ahead, sorry. I guess I wanted to make my thoughts really clear on this. I do support giving permission for West Ada to play in category red, which I'm not sure is in our plan today. But I think at the end of the discussion, whatever it is, I hope that we're really clear for parents to know kind of how this looks and what the guidance looks like, because I do think it's a little bit muddy when you're just trying to read through it to understand what that looks like. But if we were to allow for that, I think we have to make some changes, correct? If we were to allow for competition in red.
Yes. Chairman Klopfenstein, Trustee Ozuna, you're correct. We would have to adjust it. I believe it's minor changes. I believe there are some specific things in wording that we would have to follow. We have CDH guidelines already about, or I should go to the Rebound Idaho stages, about what it looks like in stage 3, what it looks like in stage 4. If it's in stage 3, it states it's 2 teams that can come together, and we won't have fans there. If it's in stage 4, you have a little different step that you have a controlled setting of parents. Sports are going to look a lot different. If and when we start to play sports, it's going to look a lot different. We're not going to have the crowds, but right now it's what the norm is. We're creating a new norm, and that's what we're trying to do with these sports. And that's going back to the football will look different.
Mr. Moore, I think Rebound Idaho has 5 stages, is that correct?
No, it's only 4.
There's only 4, excuse me. So how do you translate the 4 to our 3?
3 is competitions between 2 teams. And they mentioned the word scrimmages. Now, I think if you go to CDH and you say, hey, here's our plan, how to handle it, and certain sports are very easy, like cross country is, and I shouldn't say very easy, it's easier to adjust for a cross country match. You bring, and I'll just use our schools, we bring Mountain View and we bring Meridian together, and they set up for a cross country match. We don't let fans in, we let them run. Volleyball, same situation. We bring Centennial and Rocky together, and then we just let those kids play. As we move into stage 4, now you can get into that higher level of fans, is really the difference. But we want CDH's blessing. I think we all agree with that. But it's obvious that some school districts have been able to take plans to them and say, show me your mitigating factors. Show me the steps you're taking to put our kids in a safe situation. The IHSA has set up guidelines for us that specifically state, within every 15 minutes, you need to take a break, and you need to do sanitation breaks, which is different. You need to take your kids to the side and do things. They've extended, I'll use football example, they've extended the sidelines from the 10-yard to the 10-yard line. So now you spread kids out. We've put things in place that would help us to be able to create that opportunity to play the event.
Excellent, thank you. Any other trustees for questions for Mr. Moore?
A couple, Mr. Chairman, if you don't mind.
Go ahead, please. Okay. Trustee Johnson.
Jason, can you tell me how many players are typically on in our football rosters?
Chairman Klopfenstein, Trustee Johnson, we have a variation. We're sitting at some of our schools 150 between 3 teams. So I would say 50 at each. There might be a few more, there might be a few less. I think the one thing that I've seen from our coaches is we've emphasized so much the pods or the small groups that they've really cut down. And in years past, I'd give you an example. There might be a junior kid that's not quite varsity level, but he's also can play JV, and so they play in both ways. I think our coaches are going to be more aware of that this year, and not swing that players, you know, as we said, we won't bring him up and back. We'll just say, you stay with this group right now. And sometimes it's struggle because now we're taking a kid that might have that opportunity to play at both levels, but because we're trying to keep consistent pods. Those are just some things that we see. But right now, I would say all of our programs are running between 140 and 160 kids in the entire program for football. Volleyball, we have 4 teams. You're probably looking at 60 kids between the 4. Now they play at different times, and our requirement would be is once a team plays, and then they would move on, the next team would come in. And we've talked about how we would clear the gym and just minimize the amount of people in there.
Thank you. The reason I asked that question is because it gives kind of the most, right? I think the football team's probably the largest. To Mr. Chairman, so a couple things. One, I think Trustee Newhoff brought up that we can operate in multiple ways in a yellow. We can also, based on our plan, operate multiple ways in a red. So we built our plan that way. When I look at the Central District Health categories for sports, and I think sports has actually given me some clarity around how we can actually apply what we learned from sports into our schools, right? Because if I think about the size of a football team and 150 kids, and we're doing that fairly safely, that's what we're doing when we start to pod kids in schools. So we're taking those lessons learned and putting them in place. But to your point, Central District Health actually has 3 different options for Category 3 for sports, which tells me that even though we have a what, which is what the category is, we have had actually historical information from Central District Health that says we can apply the how in more than one way, and we've done it with sports. So I think, I guess where I'm uncomfortable is that we say to our community, sports is important and we can keep that happening in person, but our education isn't important enough to put that in person. And that's where I'm challenged with, I actually am more with Trustee Smiley, and we've learned some lessons, let's get going and let's figure this out. And however we do that may look different, but we've got to start to use the lessons we've learned around mitigation and add that educational criteria into it and move in that way. And we've got historical preference from CDH that says we can do it. There's more than one how to do it in the same Category 3.
Trustee Newhoff, do you have a question?
No.
You moved.
Mr. Chairman,
Trustee Smiley.
just to follow up on what Trustee Johnson said and what Mr. Warr said, I cannot see, if we are in Category Red, any possible way that we could justify a football season. I just can't, I'm sorry. I think we'd get chewed up in the press and we would deserve it. You know, if we go in Category Red or Category Yellow, we could probably figure out a way to do it. I just don't like the optics because we're sending a message unintentionally, but we are sending a message that, well, there's academics and then there's sports, and I don't think that works. I went by because I spent 6 years as either president or vice president or some kind of an officer in the Centennial High School Band Boosters, and I went by Centennial High School, and there was the band out in the parking lot, all distanced, but they were absolutely going through their drills like I sat through those mornings when I got up at 6 in the morning and got my daughters out there to practice with the band. And you know, we often joke that I think they practiced more than the football team. And I will say with a little bit of pride, they were district champions every single year. And those kids, you know, I think that is the key. It is, those kind of interrelationships are important, but the academics has to come first. And I know that the kids were out there, they were in the parking lot, they were out in the open air, they were doing all the precautions, and I have to confess, I just parked my car about, you know, across the road and just watched them, and memories came back. But I think that is one thing, as we consider this decision tonight, I really would urge my colleagues to think that there are a lot of implications. And what you do, Mr. Ware, is so vitally important because we have a number of people that are employees of the district that I can remember in very, very good times that were on one of my sports teams. And I will say, a lot of those kids can remember things that we said and did out there on the basketball court or on the football field. And they go, now what was it that you taught again? So that kind of thing is really important because we are looking at the whole child.
Yeah, I do.
I apologize.
No,
sir,
you're
if
fine. I know it's getting a little bit late.
I know.
And I do want to focus on getting a decision. So what I'd like to suggest is let's do a 10-minute break. And in that time, let's kind of think about motions you'd like to present. And we'll go into the next phase of this. So at this point, we'll go into a 10-minute recess.
Thank you.
This is 8:26. We're going back into session, and we're now in the action portion of our agenda for the fall opening plan and category. And I would entertain a motion at this time. And also, just for a little process, just to make sure we're clear, what we'll do is whoever's going to make the motion, we can have discussion on this, but the final motion has to be written, and we'll provide it to Troy's team to be able to post up on the screen to make sure that we're all on the same page, if that makes sense. Okay, go ahead. So at this time, do we have a motion?
Mr. Chairman, I'll kick us off.
Trustee
And then
Johnson.
we can go from there.
Okay.
So I move that we adopt the current CDH category of red, and that our operations for starting on September 8th would start K through 5 students in alternating days and middle and high school students in remote learning.
Could you repeat that one more time? I'm sorry.
Yeah, I actually have it written too. I can email it.
You probably have to do both, actually. I just want to make sure I'm clear, actually.
Yeah. I move we adopt the current CDH category of red, and that our operations for starting September 8th would start K through 5 students in alternating days and middle and high school in remote learning.
Okay. Would you forward that to Troy?
As I get the Outlook working, I will. Coming in with no subject. I was hurrying.
No, you
Oh.
take your time.
That's on me, Troy.
Okay, so there's the motion on the screen in larger font. And is there any, that's the main motion. Is there a second?
I will second for discussion.
All right, Trustee Ozuna with the second. Is there any discussion? Trustee Ozuna.
Trustee Smiley, one thing in this motion that I think would be helpful to have or to talk about is what that plan might look like for middle and high school. If there's a 2-week, if you're suggesting a 2-week phase-in or a 1-week phase-in or a follow CDH with the, start date a week to follow. But I think that might be helpful to see here.
Yeah, Mr. Chairman, I can answer the question because I have it written. I just didn't share it with the motion. But so my intent is that we start the K through 5 alternating in the secondary remote so we can see how, kind of gradually see how the protocols work. And that if we see success in those first 2 weeks, plus if CDH moves to yellow, so there's those 2 variables that are unknown at this point, then we would then add middle and high school to the alternating days. So, but we will have another board meeting within there, so that's the only reason why I didn't make it part of the motion. I could.
Trustee Smiley.
Mr. Chairman, I like the intent of the motion, but I do have some problems with the wording. The category red and then say we're going to do alternate days, that just doesn't work. I don't have a better suggestion, but that's sending an absolute mixed message, and I cannot support that motion as is written. We either need to say we are doing a yellow plan with K through 5 students in alternating days and middle and high school in remote learning. I think it would be more intellectually honest to say that is actually a yellow category. because it is. It's blended.
It is, Mr. Chairman.
And I, you know, I here again, I say this because whatever we decide, I will be supportive, but I think that's, I can't support the wording the way it's written.
Tracy Johnson?
So, Mr. Chairman, I'm open to some wording adjustments. I'm not set on any wording. I think that the intent's the real important part. I would only say that our current plan allows in red and in yellow, and maybe Troy's going to bring it up for me, alternating days is allowed in both categories. So that's what we adopted last time. So I frankly don't have I stuck with the red only to stick with alignment to CDH, but our plan, our reopening plan, allows us to be in remote or alternating days in both red or yellow. So that's, I guess, again, the language is open.
Trustee Newhoff, did you have something you'd like to add?
Oh, yeah, we had this big discussion. The color categories are an epidemiological level. Whether we're remote or alternating or full on, that's our response, okay? We've gotten way too wrapped up into what red, green, yellow means. The issue, and there was a lot of suggestion last time, and I'll note that I think the vote was unanimous to make that change to the plan last time. But there's been a lot of suggestions, for instance, with this motion, that there might be scenarios under red that involve having kids there at least part-time. And there might be reasons under yellow where you wouldn't want to have kids there. And so, you know, I guess I don't see where it's not acknowledging CDH, and that was my point at that meeting several weeks ago, is that we have to acknowledge CDH and the reality of what the epidemiology is. The question is what our response is. This is one motion to address that response that is consistent with our plan, as Trustee Johnson noted, because those options are there. The question is whether, in acknowledging red, this is the way you want to do it. So I guess as I see it. I mean, the red is CDH's call. We're acknowledging it as I see it in this motion. The question is what our response to that is. I don't know, but.
Thank you very much. Trustee Osuna, did you have a response to this? I wasn't sure if you wanted to chime in.
No. Well, actually, I do.
Okay.
I would like to have some consideration to maybe whatever the motion is that we put in a mandatory mask mandate.
Beg your pardon?
A mandatory mask mandate.
So
I'll just throw that out there, that I'd like to maybe give some thought to whoever's making a motion that we maybe put that in.
Okay. So I take a friendly amendment. I also didn't touch sports because I thought we wanted that as a separate, and would be open to the mask discussion as a separate too. So whatever you guys, but I would support that friendly amendment if that's what the board would like.
Okay. Other trustees? To be frank, for myself, just to be on the record, I would feel very uncomfortable in red to have K through 5. And the reason being is that from what I've understand as far as epidemiology, whatever, I can't say what Trustee Newhoff says, he's too smart for me. So I believe the concern is that children K through 5, it's an unknown, and I think for CDH, I believe they've acknowledged that. So I'd feel a little uncomfortable without CDH guidance to follow that plan. However, again, I would feel very comfortable with some sort of language where we stagger, which we've talked about, where possibly giving Dr. Reynolds some ability to coordinate us into yellow, should the CDH guidance kind of guide us that way. I guess I'm a stickler. Red equals online. So do we want to move for a motion, or trustee?
Mr. Chairman, could we have Mr. Heller or Dr. Reynolds speak to the liability issues that you mentioned earlier?
The liability issues?
Absolutely.
Dr. Reynolds, would you like to, or would you like to have Mr. Heller take that?
So either one of us would be happy to address that. So I'm guessing that the question is, if we ignore the CDH category, are we liable if we go into yellow? Is that the question?
I think the chairman was saying that if we were to open in blended learning, if CDH is still in red, that we may have some liability issues. I don't want to put words in your mouth, but
That's
is that?
basically what I understood from Karen Echeverria.
So, and we had talked to council about this a long time ago, and we had also received written communication from Morton Insurance regarding this issue. And what we were told was that the insurance provider would not cover any district for litigation regarding COVID. But they went on to say, and it was mentioned today, and it was also shared with us by Amy White several weeks ago, is that you would have to be negligent. So as long as you have your safety precautions in place, the protocols are in place, might you still get sued? Yes. But to prove that you were negligent, you'd have to, I mean, that was part of the argument. So, Mr. Heller, am I saying these things?
You are. So, Chairman and trustees, so one of the things that has come out recently, and I know that you mentioned it earlier, is Idaho School Boards Association, even today, and then Anderson, Julian Hull has talked about the idea of if a school district were to operationally go in a direction that was contrary to the Central District Health recommendations, that could be perceived as a form of negligence. So, when we talk about council saying negligence, it would be one of the factors that could open up a school district for liability. This is now that language that's come up. So I want to just talk about really quickly that CDH and their category recommendations, and they are recommendations, and they very specifically outline in red what that looks like in terms of the level of spread in the community in red. And then below it, they have their operational recommendations for school districts. And their operational recommendations in red is short-term, targeted, or extended school closures. We made some choices in a board meeting a few weeks ago to move some of that language, that targeted short-term extended school closures, into the yellow category so that we gave ourselves the opportunity to shut a school down even when the rest of the district is in yellow, or potentially to, even when we're in yellow, to run a school district or parts of our school remotely. We also added that yellow language, that staggered use of the school buildings alternating day concept, and that got moved into red. The perception in the world out beyond the walls of this room are that making that transition, that changing that is contrary to Central District Health's recommendations. That their recommendations for operational planning is in red. We are using targeted short-term or extended closures. Now, there are people that can argue would targeted include alternating days? So there's ways to interpret some of that language, of course, and there's a lot of interpreting being done all over the state when it comes to that. So I think it's important to know CDH, in terms of operations, says in red, targeted short-term or extended school closures are the operational recommendation they would make for school districts in the state or in our area.
To clarify, Actually, that language came from the State Board of Education when they built out the red, yellow, and green category. CDH then adopted it. So that
Correct.
that's the State Board of Education's language.
Correct. That is correct. Yep. Initially, it started from that framework that they were part of. Yes. Thank you.
Are there any motions or changes you'd like to make? Any friendly motions? Are we at a point of a vote? Then we shall go for a vote. All those in favor, please say aye.
Aye.
Opposed, please say nay.
No.
Sorry, I didn't hear it, but was there, I have one no, and myself as a no. And you were no as well, okay. And those who abstain? Trustee Newhoff?
I said nay.
Oh, yeah, nay, I beg your pardon. Okay, so we had 4-1. Beg your pardon. Okay, so the motion fails. So that brings us then back to, is there an available motion that you'd like to bring to the table?
I'll have to write this out, I guess. Saw Trustee Johnson frantically writing something, so I thought there was going to be a motion. I didn't need to. I move that we adopt red status for the first 2 weeks of the school year, meaning that we're going to be in remote learning with the understanding that CDH may change and the district administration can move us into yellow after that 2-week induction period. And I would also add to our plan mandatory masks under yellow and red conditions in the school district and all district related operations such as busing.
Would you like a minute to write that down? Thank you. I was trying to help you.
Mr. Chairman, if I may just make a suggestion that it not just be masks, but also distancing and hand washing.
Face coverings.
Well, no, I don't want to get into that.
I'll defer to you. I'll defer to you.
I don't want to get into the shield versus mask thing. I'll accept the friendly motion from.
So you made a friendly motion for, let me just make that clear. So your friendly motion is for,
To include not just masks, but also sanitation and distancing.
Those are in our plan already.
They are already in
Yep.
the plan.
they are in the
yes.
plan, yes.
But I just wanted to make sure for the point of clarification that the motion included all that.
But those are being mandatory? Along with side activities like
It's
busing?
already in the plan.
Yeah.
Maybe you can just edit it for him.
Wow.
Okay, move us into yellow after the 2-week period?
Maybe if we read that aloud, let's try. So to adopt red status for the first 2 weeks of the school year, meaning that we will be in remote learning with the understanding that CDH may change and that district administration can move us into yellow after the 2-week period. Add to our plan mandatory masks under yellow and red, including related operations. Would that be accurate?
Yeah, I
Trustee
mean,
Newhoff?
that's my intent. I mean, I don't know, Steve, are you still willing to add the?
Well, we could put masks and
Mandatory masks, sanitation, and social distancing.
Yeah.
If I may, just to make sure I'm clear, Dr. Reynolds, would that be an issue as far as our plan? Because obviously this is being district-wide. I'm not sure if social distancing as far as like busing or sanitation, does
I
that
don't know.
require some issues as far as plan
Maybe we
goes?
should just
Just
leave it the way.
point
we
of
wrote it.
order, should we do a second first and then we can amend?
We're actually just talking. Before we have the point of order, we can actually, before we have the
Let's just
second.
leave it at mass and address the rest of it in the
Yeah,
plan.
I concur. I remove my.
I'm just throwing it out there as a point of
So
consideration.
get rid of sanitation, social distancing, and that's my intent.
I think we're gonna strike sanitation and social distancing, that phrase.
And including related operations.
Oh, no, we want, part of the point is here, we want, well, I don't know, related. The point was that we're going to have mass on the bus.
Trustee
Can I make a
Ozuna?
suggestion?
I don't know.
Maybe, and especially not knowing if this is going to continue more than once, but maybe we take the mask off the table and have a separate motion related to masks. Would that be acceptable? Or do we need to do everything in one motion?
That is up to the motion holder at this point.
Yeah, I mean, my preference would have been that we had an agenda that laid out, various things we were going to address here. I'm happy to have masks out of this and address it separately in another motion if that's not a open meeting violation. Because the agenda item only says fall opening plan category, but I guess this falls under the plan. So we could
Maybe
have
if there's a concern about that, this is fine as far as the format, to me anyway. Trustee Ozuna, would that be okay for you, or
Of course.
is that okay?
All right, well,
So
there's my motion.
Okay, there's your motion, awesome. Okay, do we have a second for this motion?
I'm going to second for discussion.
Trustee Johnson with the second. Is there any discussion? Trustee Ozuna?
My largest concern with this is I would like to see students back in the classroom as soon as possible, knowing that parents need to have a plan. And this 2-week period, if we were to go yellow on Monday, that would be yellow for 3 weeks, which might be great, really, for the community, and I know that, and for work that the teachers could be doing in the school. But I would like to see kids back in school as soon as possible.
Do you have a friendly motion you'd like to make? I mean, in other words, structure a friendly motion that would be presented to the motion holder?
No, I don't at this time, thank you.
Okay.
Chairman,
Dr. Reynolds?
Chairman Klopfenstein, trustees, just for clarification, so let's pretend that the first day of school for students is September 8th. So if CDH makes a determination next Monday that West State is now in yellow, is the motion that we would start school on the 8th in red through September 18th. That would be 2 weeks. And we would transition to the alternating day schedule on September 21st.
Well, I mean, look at the calendar. Yeah, I mean, that you would have the option at your discretion to move us into the alternating day.
Mr. Chairman, can I ask a question of the motion maker?
Please. Trustee Johnson?
Bill, help me understand why putting us in remote for the first 2 weeks is important. Like, I want to understand the thinking behind that.
Okay, as we stand now, the only guidance we have is red. So my thinking is we have to tell people we're going to start somehow. I mean, I don't see how we can be adaptive to CDH changes to a less restrictive environment now and provide clarity for our community. So I think we need to start out somewhere and say something for some period of time. I suggested 2 weeks. I know administration suggested 1 week. But I think we have to have something concrete that teachers can plan for when they go back to work tomorrow. And at this point, I mean, you can bet on futures and say, well, things may get better, and I hope they do. I hope we're yellow on Monday, but we don't know that that's going to happen. What we know is that we're red now. And if we're remote, I mean, if the idea behind our responses to these different levels is right in terms of addressing the risk, we're going to do no harm by being remote and yellow for a little bit and providing some clarity for our community for a short period of time. I'm amenable to taking it down to a week if that would make people happier. But I think we need to tell people what we're doing to start out now, tonight. Yeah. I don't think we have another option. And right now, the only guidance we have is that we're in red. Mm-hmm. And Gina doesn't have a crystal ball. No one does, because personally, actually watching the statistics on how numbers are coming in with this testing, I don't think it's quite as rosy as she presented. I think we're still seeing a much greater lag. And we don't know what the tests are being administered this week, which are the ones that are going to be partly used in the decision 2 weeks from now, what they're going to do. We just can't know. And the only guidance we have is red right now. So we either act on the guidance we have or we're not acting on guidance, I guess is where I'm at. And I don't think it's fair to the teachers when they're trying to get ready for this whole thing that we're dealing with. They've got to get something together for that first week or two of school. And the content in theory is going to be the same no matter whether you're full on live or every other day or remote. But the way you prep for that's a lot different. And I think we got to give them a fighting chance to get off on a good foot. I mean, look, there's no way to get off on a great foot in remote learning. I tried to do some remote teaching this summer and it was an abject failure, but that's my limitations. But I think we got to give them something to latch onto when they go to work tomorrow, I guess is where I'm at.
So I really appreciate the thinking because that actually helped me understand better. And so maybe I'll throw out some friendly amendments that kind of bridges the gap. And actually it's kind of a conversation with Dr. Rannells and now hearing your thinking is maybe we do go to that 1 week. And in that 1 week, we allow the teachers, which is what they've been asking for, is to be able to bring in kids in smaller pods of 5 in that first week to help get them set up on their computers, help get them and give that flexibility in that week. We're still in a red, we still have, but and so with those two kind of amendments, then I think I could get behind this.
And I've suggested something similar that, I mean, there's no way to start out a kindergartner dead on remote. That device distribution, my suggestion was that we tie in device distribution with sort of meet the teacher and getting the kids induced somehow in very small groups where you can absolutely social distance and do the things you need to do. There's a parent there. It's a lot more controlled environment if we're in red. So, I mean, I think we could easily do something like that, but
I don't think we need a motion for
that. I think that's part of device distribution, to be honest with you.
Yeah. So then maybe I'm just suggesting we go to 1 week.
So Trustee Newhoff, the friendly amendment to you is to change your wording from 2 weeks to 1 week. Is that correct, Trustee Johnson?
Yes.
Yes,
I
okay.
can live with that.
So do you accept that? Yes, you do, okay. So there is, so we have a change. Need to vote on this to make, to,
We would need to change the top two. 2 to 1.
Mr. Chairman, let me,
well, we have a friendly amendment on the floor first. I think we need to go to a vote for that.
oh, sorry, you're right.
So all those in favor of accepting the friendly amendment from 2 weeks to 1 week, please say aye.
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 And Chairman is aye as well, so unanimous. And Trustee Johnson?
Yeah, so we've had this problem before where we weren't real clear what we really wanted. And even though we were all aligned in the room here, we weren't real clear on our communication. So this is my only reason for kind of throwing this suggestion out. I think we do need to provide that language around I don't know what it is yet, so somebody can help me script it, but around we would encourage schools during the first week period to bring in small groups of 5 or less to, I don't know what the language is, but something, and Mary Ann, maybe you'll help me here, but to get the school year started or something like that, just so we are clear that we support that, because if we leave it out, even though we've said it tonight, it may not get communicated that way, and I'm uncomfortable that it doesn't.
I believe Dr. Reynolds, though, had already given guidance that, is that correct, Dr. Reynolds, that that would just be part of the plan to distribute devices? And the issue
So
of,
we have shared this idea with all of the principals, region by region. And many of them were already planning to do some kind of welcome back. But I agree with Trustee Johnson that the more clear we can be in terms of what we're encouraging or what we're allowing or what we're permitting is a good thing. So I might make a suggestion that might be a separate motion from this, so we don't get too many things going on in the motion. It's just a suggestion, but I think the issue of making a decision tonight in terms of how we're going to get started will be well received by a lot of people. And I just want you all to know how much we appreciate the deliberation and the painstaking attempt at trying to make sense out of something that none of us have wanted to accept. But with that, if Chairman, if the board would consider voting on the first motion, how we're going to get started with those parameters. If things change, then we could move forward and then have a second motion that would state the flexibility within that motion for teachers to feel supported and confident that they can bring small groups of kids in to hand out devices to welcome them to the new year. I know some teachers are talking about creating a schedule like parent-teacher conferences where they just have one student come in at a time. I told them, however you feel will work best for you and your families. You have our support to do that. But for them to know that the board also supports that, I think is a good idea.
excellent. Trustee Newhoff, you've voiced some concern about the process. Is that agreeable?
About the, what?
Multiple motions.
Yeah, I'm fine with that. I
Okay.
mean,
Very good. Trustee Johnson, would you be comfortable in having that friendly amendment more as a motion later?
I am. I'm totally comfortable with a separate motion on it. I actually have a question on our motion now as I read it.
Please.
We say yellow, but we have multiple options in yellow. So I want to be clear, how I'm reading yellow is if CDH changes us to yellow, district administration can move us to yellow, and that's alternating days. But I don't know if that's what the intent of the motion maker was.
The intent is if the CDH guidance level changes, that after a week, that administration could make a change in our operational mode that they see fit. If they see a need to continue remote under yellow, they could do that. Or they could go to alternating days, as we see what the scenario is. I mean, my guess is that they're going to want to, if it's in yellow, they're going to try and get into alternating days as fast as they can. So.
Dr. Reynolds?
So with that, then and I know we'll have time to discuss all sorts of scenarios that hit us over the next year, but that the idea of us going into yellow follows our plan that we've worked on and submitted in terms of alternating day schedules. And not that I need you to do anything about it tonight, but based on what Dr. Newhoff just said about the intent is, so what if we are in yellow by CDH, but we have a school that has a confirmed case and that it was with it, so it's within that community. So a student gave it to another student, or a student had a teacher. So within that, we would need the flexibility that we might have to close one school down or one classroom down, but not necessarily 56 schools.
Now that I've heard that, I think my concern with that is that doesn't give people something to plan around. So that's probably my main concern, is that without that clarity, nobody knows what week 2 looks like today.
Well, the only way you're going to have any clarity about what week 2 is for us to just say right now, and that's what you didn't want us to do. I said that we'd just go remote for the first 2 weeks and we'd have absolute clarity then. Here, the clarity we don't have is a crystal ball to say what CDH is going to say in 2 or 3 weeks. We can't have that clarity. So there's no way, unless we arbitrarily, and I think the only arbitrary thing we could say is that we're going to be remote for some more extended period of time. That's the only clarity you can give for an extended period of time here. Given that we're going to have updated levels of community transmission
Next Monday.
guidance from CDH. So, I mean, if you're wanting the clarity to be that we're going to go alternating days if we're in yellow, then we need to go back and change our plan.
So 1 week or 2 week, we still have the same problem at week 3. So that, I mean, I understand that. I think the motion can have clarity or the plan can have clarity, either one, but we need clarity. So, because I don't know how people plan around that. I don't even know how I would plan around that. I know what the first week looks like, but I don't know what week 2, or if we change the wording back, week 3 looks like. And that's probably my concern.
Well, there's not going to be clarity. I mean, there's no way there's clarity if we're going to be adaptive. And so, I mean, the only way to provide clarity is to just scrap in-person school this year at this point and say we're going to go remote for the whole time. That's the only way to provide clarity for an extended period of time. Otherwise, you're going to have some way of being adaptive. Right?
Sure.
I mean, I don't see any other way around it.
Trustee Smiley, would you like to have a
Yeah.
comment?
Mr. Chairman, I absolutely get your intent, Trustee Newhoff, but I am still going to fall on the field that we do need to provide clarity, and we do need to make this decision tonight. I made it clear that I think that we need to do some kind of a yellow as a strategy overall, understanding very clearly that we may have to switch that. If we have outbreaks and things like that, we need to give the superintendent the authority to move us into a red category, either in a individual building or district-wide, or maybe a cluster. I think we hire a superintendent to make those calls. I could live with this, but I think it's a bit confusing. I think we kind of have to, earn the huge paychecks we're getting and make a call. Superintendent, if you'd like to discuss, I'm absolutely willing to listen.
Well, we should probably call for the question, but I would say from our staff, this is clear to us. We start school in red. If sometime between now and September 8th, CDH changes our category to yellow, then we'll take a week, we'll work with all of the departments and set the date and transition to an alternate day schedule, kindergarten through 12th grade. That's what our plan says.
Yeah, for me, I'm frankly very comfortable with this.
I move the question, Mr. Chair.
Thank you very much. All those in favor of this, we have the motion to move. All those in favor of approving this motion, please say
Hold
aye.
it, we have to move to call the question first.
You have to move to call the question.
Yeah. So in other words, the first vote we have to have is to call the question.
Okay, I beg your pardon. You are definitely helpful. All those in favor of calling the question, please say aye.
Aye.
Aye. All those not in favor, or against?
Nay.
Nay.
I don't actually know what that means.
In other words, what we would
If you
vote
had something
on.
else to say, then I'd say nay, so that you can have more discussion.
I have something else to say, yes.
I beg your pardon. All right.
Vote no.
The motion fails. Okay, Trustee Ozuna, please.
The one thing that I wanted to ask in this related to athletics, and I was hoping that we would leave it really clear with where we fell. And with this, if we were to go CDH category yellow and remote learning, where do you fall in the athletics of that? Because I think it's really important for people to understand that.
I intentionally did not mention anything about athletics in this motion so that we could get this, something settled about school starting. And since we're going to have multiple motions regarding our plan, if there's something we want to address with athletics, my intent was that that would be a separate motion.
That's perfect. I just, when we leave here, I want families to know and that to be communicated and over. Thank you.
Excellent. Okay, so we will have the vote now. Is that
Yeah,
appropriate?
Mr. Chairman,
Trustee
if I
Smiley.
may suggest, I think as I read this, I've read way too many essays, to adopt red status for the first week of the school year.
Is that a
Because
friendly
1
amendment?
week is a bit redundant. Would that be acceptable to the maker as just a typographical,
Yeah, I guess there's the other ambiguity that it's a short week, right?
Oh,
Yeah.
well, then you'd have to, yeah, you're right. So
For the week of September 8th. What's that? That's the first week of school. The 8th is a Tuesday. goes to,
So you're revising your motion to adopt red status for the week of September 8th,
yeah.
first week of the school year.
First week, okay, that would be acceptable. That would be acceptable.
And then we, yeah.
Week of September 8th. Oh, he's got word problems. Ritual.
No, get rid of the first week of the school year.
Yes, the motion would be to adopt red status for the week of September 8th, meaning that we will be in remote learning with the understanding that CDH may change and that the district administration can move us into yellow after the 1 week period.
I'd say after that week instead of the 1 week period.
After that week.
After that period.
That week?
Yeah, there we go.
Add to our plan mandatory masks under yellow and red, including related operations. That'd be the motion. So all those in favor, please say aye.
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 All those against, please say no or nay.
Nay.
We have 3-2, so the motion passes. That brings us then to, it sounded like we had another concern about, Trustee Johnson, you had another motion you'd like to bring forth?
I think we should address the sports issue first.
Up to you, yeah.
I'm waiting on that.
Then
And the mask issue, I think the one I had is just friendly language.
Trustee Ozuna, then you had a motion you'd like to present for sports? Or like to start discussion?
And I'm not certain that I had a motion necessarily. I just wanted to make sure that we understood what this means related to sports, because there will be a little bit of crossover if we go into yellow on Monday and we're in remote learning for a period of time. And, I'd just like maybe to give the district some flexibility in what that looks like, or I don't know if we need a motion around it, but.
Could I ask for some, I'm sorry, Mr. Ward, can I ask you a question? Just that I think might clear this up. Sorry to make you walk all the way up here.
I need the exercise.
So my understanding from what Mr. Ward said is that the guidance about what state our athletic activities are on are not governed by the red, green, yellow, but are actually governed by
Rebound Idaho.
by the Rebound Idaho, assuming it survives what's going on in the legislature this week.
No, it is.
But is that a correct characterization?
Chairman Klopfenstein, Trustee Newhoff, that is correct. And I'll clarify a little more. We have the right to create our plan within our district. The IHSA gave us some guidelines and some expectations, and there were 4 of them. We have those guided, but then we could decide, do we want to follow the rebound plan? Do we want to follow the green, red, yellow?
And what are we following?
We're following Rebound Idaho.
So,
But we have, if we go into yellow, we could have the right to play because it's the way we wrote our plan. Does that make sense? So, and I would add this, it's our plan. If we have it written that if we were not in red, we wouldn't be able to play. But the writing could be as if our board or if CDH put us into yellow. If we were in yellow in either case, we could write it that way. It would just have to come back to you for approval.
okay, so here would be a motion I would suggest with regards to this. So I just want to get your feeling on it before I make it. The motion would be that our level of athletic activity is governed by the current CDH color status.
No.
Rebound Idaho.
Rebound Idaho. Yeah.
Okay, so okay, so, and here's, I think, and this is part of the confusion of Trustee Azuna, is because you've talked two different ways here. I mean, we did Rebound Idaho, and we're in stage 3, right, because of the Ada County order. But now you're talking about whether we're in yellow. So you're not following Rebound Idaho. So you're doing two different things.
Well, Chairman Klopfenstein, Trustee Newhoff, when we built this plan, we thought it was best that we were going to be in school, and that was part of it. We felt that same way. But as we come into this uncertainty at this time, that opened us up to a little bit of, the Rebound Idaho was always our plan. That's what we followed. That's what CDH suggested that we follow. We just tied in the yellow plan because we knew it was going to bring us back into school, in-person learning. So I can see I've confused you a little bit.
Well, yeah.
Yes.
It might help if you can see what the crosswalk, because there is a crosswalk.
Yeah. What stage is that?
So,
Troy, let me send you the link.
so we are currently in stage 3 of the Rebound Idaho plan, which says that we could hold scrimmages, but we would be limited on the amount of people we could have there. In stage 4, they would allow for games. We just have to show CDH our plan. So right now, as we stay in stage 3, hypothetically, if we showed the plan to CDH, it would show that we could have scrimmages. We had taken the step that we were just going to focus, we're just going to focus on that if we came back in person, then that would allow us to play. But really within our own plan, we have the right to write it under the Rebound Idaho plan to say that we could play as we move into stage 4 or stage 3.
This is the Central District Health document that
Yes.
walks the CDH and the Rebound Idaho. So category 3 is the red, and why they have a couple different options within the Rebound Idaho stages. So they link them, they crosswalk them.
Yeah, I think part of the problem, actually, if I may say, part of the problem with this, because this is something that Mr. Warr and I had discussed last week, it's confusing partly because in our plan, we talk about Rebound Idaho, we talk about CDH, and we talk about IHSAA. And in a way, what our district is kind of a little bit of a hybrid. And what Mr. Warr has done is that so even though IHSAA, for instance, is in our plan, he actually has, with the gentleman's name's Tyler?
Ty Jones, who's the executive director.
So Mr. Jones, who is one of the representatives of IHSAA, had basically wrote saying that they accept the plan and would allow, and would be very it would be understood for them that would be still a good plan, even though it's not tightly aligned to their plan. And I think the CDH also gave similar language. It's a little bit confusing just because there's so many nuances to this, but that is a consideration. I know it's kind of confusing, but there is some nuance to it. But basically, I think, and the other issue is that we have 4 stages here. And tell me, I think stage 3 of Idaho, or the governor's plan, basically means that it's not really red. It's more like an advanced yellow.
Correct.
When it comes down to it. So even though we might be in a red now, we are in a red now, the sports program is basically in a high yellow, is what I'm reading.
Correct. Well, and that's Chairman Klopfenstein. The aligned with the community category 3, which would be red, is how it's tied in. And I don't want to go off of other districts, but CUNA is going to play this week, and I read their plan, and it's very similar to what our plan had come along in. So I think it's as long as you can kind of go to CDH and get their blessing about this would be our organization, this would be our plan, they'd be supportive as long as it's showing the mitigating factors and then you're taking the steps necessary.
Mr. Chairman, I have a question around that, and actually it might be more Dr. Reynolds or Brett, but if we do something different, so the answer that we got earlier was if you go against the CDH category, that could be considered negligent. If we do something different for sports, does that also put us at that risk?
Mr. Moore?
Chairman Klopfenstein, Trustee Johnson, in working with Central District Health, if we put a plan in place and we show that we're taking those steps, there's an inherent risk in anything, but we're showing people that we're making the steps to try and mitigate those factors, which we've done. And if we would have had issues, we would have had them this summer. Really, the only difference we're talking right now is our kids have been participating. They've been competing within their school. We're trying to talk about the next level, which is to bring two teams together. So if we haven't faced that at this point, you know, that would be the next step with Central District Health, is getting them to say, as we bring two teams together, what does it look like? Is your plan solid? Would you feel supportive of no fans, some fans? How do you handle tickets? How do you handle the restrooms? How do you handle going in the gymnasium? Those things.
Okay. Mr. Chairman.
I still would like clarity from the legal standpoint. I'm totally comfortable that Mr. War has the operations down entirely, but I think the clarity is around, because I'm actually not uncomfortable with our schools entirely. I mean, I'm comfortable with our schools operations too. It was the legal question that was my question.
And for us, because we have in writing from IHSAA and from CDH that they approved our plan for activities.
Yeah, there's no legal ambiguity, correct?
Mr. Chairman.
I mean, there's always, I never know about those outlier things, but I know we've gone through every step to make sure that we're doing all the right things in the right way, and that those two organizations are the ones who have given their stamp of approval for what we're doing, and it certainly has been a huge discussion the last several months with SIC, athletic directors and principals and superintendents. So some districts, because of their circumstances, chose not to have sports. Other districts, based on their circumstances, chose to allow practice and workouts. So the question becomes then, in our plan was, when do we get to the point where we can have a competitive game? So when can Rocky play Mountain View? And in our plan, we said, as soon as our schools, according to CDH, entered that yellow phase where we might have an alternating day schedule, that when we have kids on campus, then we could start competing.
Correct.
Okay.
Trustee Smiley?
Mr. Chairman and Jason, help me out here. Where are we as of today with our fall sports? Will our student athletes, and I'm talking everything from middle school up, because we do have our tradition of normally football practice starts quite early, and we even have our first games often in August. But where are we right now? Have we delayed the opening of the season already? And could you please bring us up to speed on all of our fall sports, cross country, football, volleyball, all of our sports at both the middle and high school level? Where are we right now?
Chairman Klopfenstein, Trustee Smiley. We were supposed to start on August 10th with all fall sports. We delayed a week because we knew where we were at. We knew that we wouldn't have a decision on if we were in school or we were remote. So we delayed, started the 17th. All of our teams, cross country, volleyball, soccer, football, We sponsor girls rugby, our band, chant, cheer, dance. They're all practicing. They're kind of waiting on us. We have missed. Rocky Mountain and Mountain View should have played a game last week, and Eagle. Meridian was supposed to play this week in football, and all of our other sports. We've canceled early cross country, volleyball, that would have been, most likely, most of the stuff would start next week. So, but we have canceled some stuff already.
So, Mr. Chairman, may I follow up? Because I want to really understand this. I really want to understand that. So we've basically canceled that first week of all of our sports. So where would we be at with the actions that the board took? Would we cancel another week? And when would our first games start?
If the board acted and said we're in red and there were no adjustments to the plan, we would allow our teams to continue to practice, and we would not play games until we had a determination that we were heading back into learning. And that's whether that was in-person learning, unless we adjusted our plan. That would be our plan right now.
Okay. So right now, there would be no games between intra-district, and outside of the district. So in other words, there would be no games against Bora.
Correct.
But there might be a game, Rocky versus Mountain View.
Not until we go yellow.
Not until we go yellow. Okay.
if our
I
plan
really
didn't
want to
include
be,
that.
and so that not only depends on what we have decided as a district, but what Nampa has decided, what Boise has decided, what Twin Falls has decided, and I don't know. That's over my head. I appreciate everything you're doing, Jason.
It's
I
not
really
until we
do.
go yellow and alternating days, right? We have to have some in person is kind of what our plan says.
Yeah. Okay. That helps.
I mean, it seems to me the biggest kerfuffle here is if CDH, I mean, we've got this alignment and basically stage 0 through stage 3 is red, and then stage 4 encompasses green and yellow, right? That's what the aligned with committee. So, but what happens if we go yellow and CDH doesn't lift the stage 3 order for Ada County? That's where I see the ambiguity here.
Chairman Klopfenstein, Trustee Newhoff, and it's hard for me to speak to this, but there's a game Friday night with a school in Ada County playing a football game. So it tells me, and this is what we've been informed, that if we take a plan to CDH and they approve it, that they'll work with us. But I can only speak that they did it for another district that's in Ada County, not for,
Yeah,
for us.
I guess it's trying to get back to the clarity that Trustee Azuna wants. I mean, the problem, I don't trust CDH necessarily to catch that little snafu, all right, with how things are supposedly aligned here with, because it takes them making a motion in their board in an open meeting to get out that stage 3 change. This is different. So the question is how do we bring the clarity that Trustee Azuna is talking about here with our plan? I don't know.
To me, practices are happening, and they've been happening all summer, even though fall practice didn't start until August 17th. They continued. They were actually happening all summer, just some of the other sports, right? I guess some of the sports were practicing early and some of them delayed and started on August 17th. But so that's happening. The plan allows for you to adopt the governor's plan or create your own.
Correct.
The IHSAA plan allows you to use their guidelines or create your own. And so there's flexibility in there, but along all of that, it says must be approved by the school board and must be done in guidance with CDH. So I think what we need to decide is whether or not we want to do something to allow these kids to continue to play and change that language a little bit, because I think we've trapped ourselves in the way that the language was written, anticipating being in yellow. I understand you're right.
Chairman Klopfenstein, Trustee Ozuna, it's correct. I mean, and if, kind of back to Dr. Newhoff's comment, if you look at stage 4, if we aligned into category 2, which would be yellow, that's where that mixes together, and hopefully that helps to understand it. But Trustee Ozuna is correct, is if we devise our plan of what we think athletics look like or extracurricular activities while we're in red, and we share that with CDH, and we put a plan in place, or we change, and I would suggest maybe changing the wording to, if we're ever in yellow, if CDH puts us in yellow, or if our school board puts us in yellow, then that would allow, because there could be a point that we are in red and CDH has us in yellow. So, like if they put us in yellow next week, but you determine we're in red, somebody's put us in yellow. We are in yellow at
Trustee
some
Newhoff?
stage.
Yeah, if Trustee Azuna's contention, I'm sure it is right, that the athletic plan requires board approval, we're not going to solve this tonight. We need to have a plan to vote on. We might have to have another meeting next week or something that has an athletic plan that we can sit and vote on and provide the clarity that way.
You know, actually, within the current plan, we have 3 points that are IHSAA plan points that frankly require board approval, or at least board review. And so I would totally agree with that.
I don't know, I mean, it just seems to me that we're not going to, I mean,
Yeah.
you've been great. It's not this is confusing, and I think given that point and the point that Trustee Azuna made, I think we actually have to have a more focused agenda situation around the athletic plan.
I would agree with that, absolutely. In fact, if you wouldn't mind, Mr. Warr, if we would, I think that would actually be really healthy for the district. It's obviously nothing is going to change within where we're doing is fine right now. So moving forward, we'd still be, athletics would still be in this current position.
Correct.
So we would have time to be able to deliberate at another meeting. I think that would make total sense.
I'm confused because I thought I'm super confused now because I thought I heard Dr. Reynolds say our plan in yellow, if we're in yellow as a district, then our plan that we've already adopted and approved with board approval of it says that we can play the intra-sports in our current plan if we're in yellow in-person learning. So that's what we are at today.
No, we're red. We are red. right?
Well, sorry, if we, hypothetically, if we were yellow today, is that where we would be at? That's what our plan tells us, that's what we've adopted already. So right now, our sports categories align to our in-school categories. So I don't know what, unless we want to change that decision, I don't know what we're.
Well, I think that what Trustee Newhoff is saying, that there's points of ambiguity that really require additional review. And there Mr. Warr already has an additional plan that's being readied for us. And so it just behooves us to just wait, maybe just table this portion, move on to, maybe we could even do it even next week if you'd be open to that, and then discuss sports individually. I think that would be very healthy, actually.
I'm comfortable discussing sports individually. I'm not comfortable making sports have a higher priority than education for getting back in person.
Mr. Chairman, I concur.
So if our plan aligns together, the two right now, I guess I'm questioning whether or not we need to make a change.
Trustee Zuna?
So the fall reopening plan, and Troy, I don't know if you can bring it up, but the fall reopening plan had a section around athletics in it. And in that section, it referred us to Idaho Rebounds, which is what we're looking at here. And then it also referred to the IHSAA document. Within the IHSAA document, the language in there that's part of our plan talks about how you need to have a plan with more detail than what's in here, because when we approved this plan, there was going to be further detail on athletics. So Mr. Warr had to create a plan with additional detail that the board needed to approve. And that has not come back to us yet. So under the IHSAA requirements, there are, I think, 3 of the 4 points in there that require a board discussion and a CDH review. So it's got to come back to us anyway.
Yeah.
Okay. So it just behooves us to kind of postpone this discussion.
I think
But-
it's obvious. I'm sorry.
Sorry, but the biggest thing for me is when parents read this and they want to know what's going on with athletics, it's very difficult to tie the rebounds document, the IHSAA document, and this document because they don't tie together very well. So we've got to provide clarity on that, regardless of how it fits in with the reopening plan. I mean, but we've got to clean that up.
Absolutely agree.
I'm not sure why our plan doesn't say we just align the two, but.
Well, it's our approved plan, so this is what we have to move forward with. It's what we have, so,
I would suggest we
yeah.
move on.
We move on, exactly. I would like to do the same.
Yeah.
And I think the final point for this evening was a discussion on, let's see here. We had one more item, I thought. It's getting late, and I'm getting a little bit foggy.
We had masks and then the other language still.
Well, the masks were in the,
I don't think the
no,
masks are
they're
an
already
issue.
in there. We have the policy 501.50.
I guess,
school
I
No,
guess the
we had
question
one more
is
item on
whether
this.
there was anything else with the fall reopening, for instance.
The only other thing that the board discussed as a possible motion was to encourage teachers to bring in small
Right.
groups of students in red to welcome them back to the new school year, hand out devices. But I don't know that you need a motion for that, but it does provide clarity.
So I actually just use the language and I can make that motion pretty easily, but are we closing the fall reopening plan or is that still open to make that motion?
It would be up to trustees. I think,
I- I'm willing to hear.
We discussed it. I mean, I think she ought to make the motion to.
yeah, exactly. So,
Can I
So-
use your language?
Yes, ma'am?
I might just ask.
so
Could you
could
repeat
you,
it for
could
me?
you create a written motion? Since you have a computer.
Well, maybe I can do what trustee Newhoff did, is I can say it and Troy can help me because I don't have one written right now,
Oh,
if that
sure.
works.
Troy, would you be a dictator? Awesome.
I move that we encourage teachers in a red category to bring in small groups of students, to welcome them back, hand out devices, and what was the other word? Is there anything else? Set up operations for the year, or something like that,
Distribute devices. Yeah.
in small groups, to distribute devices. Students in small groups.
Well, it's, what they do is they begin establishing those wonderful relationships, but,
And they can make sure the kids know how to log on and
yeah.
Exactly, huge problem.
do the,
Is that the full motion, trustee Johnson?
Yeah.
We encourage our teachers in the red category to distribute
Let me-
devices.
Sorry, Troy, this is going to be picky, but welcoming back students is probably more of a priority. So I guess I would say red category to welcome back students, to welcome back their students in small groups and distribute devices is probably the,
I suggest,
yeah, small groups or individually. Thank you.
Also distribute syllabus or, that's
Yeah.
more high school,
Yeah. And
not
learning-
elementary.
And learning
Yeah,
materials.
no.
How about learning materials?
Learning materials, yeah, learning materials.
Thank you.
Yeah, I know as chair, I'm not supposed to do this, but the only other, I know the guidance that I've seen from CDH was specific to 5-person groups. Is that Is that what you saw, Dr. Reynolds?
Chairman Klopfenstein, trustees, yeah, we've talked about groups of 5, but we didn't limit it to, I mean, some teachers asked if they could just bring in 1 student at a time, and yeah, that's fine.
I'm comfortable not limiting it. We have a 10-person kind of limit at CDH already,
You
so.
need parents, right? I mean, you're going to probably have a kid and a
Parents,
parent.
yeah, so I'm comfortable with not limiting it. Small groups and
Yeah,
letting
just
them.
put a comma instead of that first and.
Yeah. So Mr. Heller just whispered in my ear, because I don't know if that would change this or not, but many of our buildings are already creating welcome back plans. So I don't know if we could we encourage our teachers and administrators in the red category to welcome back. That way the buildings, I know they have.
Oh, yeah, that's fine. And then I do see one other piece, and that's welcome back their students in small groups.
So if you picture that maybe a building has created a schedule to invite families to come in, so they actually are doing more of a collective effort. So I like that flexibility. They are being so creative right now in terms of making this beginning of the school year exciting and less frightening, less anxiety.
So the only other language change, if you'll just add Troy after students in students in person in small groups, would be just for the clarity. So Marianne, to clarify what you said, small groups is clear enough and fits into what's already going on. Okay, thank you.
I don't think you'll need or individually if you say students in person, to welcome back their students in person or in small groups. So either get rid of individually or get rid of in person.
Okay, that's fine. So get rid of individual.
Well, I don't know. I guess what I was thinking about there was, the teachers that would rather do it 1 kid at a time.
Yeah, that's what I was.
I think we're okay.
Small group, I mean, 1 person's a small group, I guess. Is it a group?
Well, so when you say
For one.
Gets back to group theory.
welcome back their students.
Yeah.
Oh, so the in-person part is the
Myself and
teacher.
lost.
Oh, never mind then.
Yeah, it's
Okay,
just to
it's
clarify
fine.
how we're doing it.
So are we striking one of those
We're good on the language?
in person in small groups, or to back their students in person in small, is that grammatically correct? To welcome back their students in person in small groups or individually?
In person or
In small groups or individually?
No, and she's talking about the teachers, the in-person person.
Yeah, that's the nouns in the front of the.
Okay.
How about change that in after person to as? That work?
Yeah.
Make it less confusing?
Yes.
I honestly don't understand what you just
Distribute
said.
devices, comma, and learning materials. Oxford, comma.
Ah, there we go. Okay.
Chairman, just to clarify, some of those devices will be handed out before September 8th.
Yeah, I think this is encouragement. So if it happens beforehand, I think that's fine.
I mean, they could do this, I mean,
Yeah, we're just encouraging.
And we don't say the date, we just say red category.
Yeah. So is there a second on this motion?
second.
Oh. Trustee Newhoff with the second. Any discussion? All those in favor, please say aye.
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 And Chairman is aye as well. And that will close out this section. And I would like to suggest actually tabling the discussion E and action item F. Everyone else. Trustee Ozuna.
Mr. Chairman, it would be really nice to have this policy ready to go before we start any kind of attendance process for the new high school. Do we have any idea when that's coming in front of us?
I beg your pardon?
It'd be really helpful to have this policy approved before we start the rezoning for the new high school. Do we have any idea when that discussion is coming in front of the board?
Dr. Reynolds, looks like you have something you would need to advise us on.
Char and I have been visiting along with Marcy, and we'll begin initial steps in September, but it won't come to the board until December. Yeah.
Can we adopt our policy and review the scope at the same meeting?
You okay with that?
I think
Okay.
so.
And we might even, at the next meeting, we might have, that might be a quicker meeting.
I mean, if, yeah, I mean,
Yeah,
if we're gonna have a meeting about the athletics, we can.
Then we could probably
Yeah.
squeeze this in as well. if
Yeah,
that would be
we're
amenable
going to be
everybody.
meeting next week, it looks like.
Yeah. I
I
mean,
think
I
we're
didn't get
very
my,
close on this, so
yeah,
I just want to make sure that we've done all the work on this, that the committee can actually use the work we've done.
absolutely. And if you, and I'm sure we'll get a copy and then we could just, that make things a little bit faster as well. So anyway, I just don't want to, we spent a lot of time on the reopening plan. It's very good time, and I really appreciate the thought and consideration in this. At this point, trustee, sorry, I'm really getting tired. Trustee Smiley, did you have something you need to say? It looks like you're
Well,
kind of leaning over there.
I can just make a motion that we continue with item E and F to a special meeting of the board next Tuesday.
Absolutely.
And other agenda items as may be necessary.
Yeah, that would be
If
amenable.
I may make that motion.
You may make that motion. Is there a second?
Second.
Trustee Ozuna with the second. Is there any discussion? Seeing none, all those in favor, please say aye.
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 Chairman is aye as well, so it's unanimous. It brings us to adjournment. Is there a motion?
So moved.
Second.
Trustee Johnson with the motion, trustee Smiley with the second. Is there any discussion? Seeing none, all those in favor, please say aye.
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 Aye as well, so unanimous, I hope.
Thank you, ladies.
Wonderful night. Thank you, ladies, you're wonderful.
Ed, can I clarify when you guys want that?